warm welcome to all of you from the Noble University and Noble Nursing College and NTI and NSS Associate Gujarat. Okay, today is our session for scientific paper presentation. And special thanks to all of you, all participants, those who are participating in the scientific paper presentation. Yes, first scientific presentation is Mohini Baria. Mohini Baria.
Good morning, sir.
Good morning. Yes.
Can I
Okay,
start?
during the session, all the start your video as well as audio. Okay, it is all are recorded. Okay, or recording in all the session are recording on the YouTube's. Okay. Yes, please, ma'am. Start.
Good morning, sir. Thank you, sir, for providing the good opportunity for presenting my paper in this national conference. So I share my slide, sir.
Yes, ma'am.
But sir, I disabled to sharing my slide. So please give permission.
Okay, please wait, ma'am.
Sir, now it's visible to you, sir.
Yes, ma'am. Yes, ma'am. Okay.
Good morning, sir. Myself, Mohini Baria. I am PhD scholar, also HOD and assistant professor in Dinsa Patel College of Nursing, Nadiad, Gujarat.
Okay.
So today my problem statement is assess the effectiveness of the self-instructional module on knowledge regarding prevention and management of ill effect of web series among the youth. Can I change, sir?
Yes, sir. Continue. Yes,
So
continue.
there is an introduction about the web series. So a web series that is also known as a web show. There is a series scripted on the video of the scripted online video, generally in the episodic form, that is released on internal, which first emerged in the late 1990s and become more prominent in the early of 2000. A single entrance of web series program can be called as episode as well as webisodes. However, the term is not often used. In general, web series can be watched a range of the platform in the various
Excuse me,
devices.
ma'am. Please change your slide also.
Okay, sir. So there is a various platform, that is a web series platform, that is a Netflix, Amazon Prime, Hotstar, Geo TV, Hotpoint, Ultra Balaji. So nowadays, many of the youths would be.
Ma'am, actually your slide is not moving. Please change.
Okay, sir. Now it's visible, sir.
No, only front slide one is there. Please change the next slide.
Now,
No, ma'am.
now, sir.
Not getting, ma'am.
I don't know, sir, what happening, but I try to say.
Again you
Again, I
start the
will.
slide.
Yes, sir. Again, I will try. Now, sir.
No, not visible.
I don't know, sir, what happened, but it should be seen in my slide that is shared.
But just you click on share screen. Okay, yes, and press F5. Then you have to use the arrow cursor arrow keys for the next slides.
Now it's are visible.
No, ma'am, no.
I already shared the slides.
Okay, so you continue on this way. Please, other participants, please mute your participant. Sharon, ma'am, please mute yourself.
Okay, sir. Okay.
Yes. ഒരു സയന്റിഫിക് പ്രസന്റേഷൻ ഇവരെങ്ങനെ ചെയ്യുന്നുണ്ട് ഇവൻ ഞാൻ അറിയുന്നവനാണല്ലോ ഇതിൽ പേപ്പർ പ്രസന്റേഷൻ എങ്ങനെ ചെയ്തു നോക്കട്ടെ
Krishna, hello, Krishna,
ആ
hello, Mohini, hello, Mohini, hello, Mohini, Mohini, are you audible? Hello,
আমি কোনটা না তো হ্যাঁ
hello,
আমি কে কোনটা
hello.
Hello.
Are you audible?
Yes, sir.
Just actually last your slide is visible.
Now it's visible, sir.
No, no. Okay, now visible. You can continue on this way only. Okay, don't preview
Okay, sir.
because I think technical issue during the previous
Yes, sir.
time.
Yes, sir. Thank you, sir.
Okay, go for second slide. Just press one.
Sir, my
Okay,
problem is
done. Yes,
yes,
continue,
sir.
please.
Sir, there is an objective of the study to assess the pretest knowledge score regarding the prevention and management of the ill effect of web series among the youth of the selected engineering college of Vadodara City, Gujarat. My second objective of the study that is to assess the effectiveness of the self-instructional module by assessing the post-test knowledge score among the youth of selected engineering college of Vadodara City, Gujarat. Last one objective of my study that is to find out the association of the pretest knowledge score regarding the prevention and management of the ill effect of the web series with their selected demographic variable.
Next.
ROL. So in that study, sir, I including the three of the point. According to that, I is searching the many of the ROL. So first, literature review related to the web series. Second, that is the ill effect of web series, and third one is a self-instruction module on ill effect of the web series. So many of the reviews show that nowadays many of the youth should be habit of the binge watching the web series, so that the many of the people having suffering the psychological problems.
Okay.
So there are three ROL should be included in my study. So according to the 2022 and one of the 2021.
Okay, next please.
Research methodology of this statement, that is I adopted the research approach, that is a quantitative research approach. In the research design, I using the pre-experimental research design, in that mainly using the one group pre-test post-test research design. Populations, so in that I selected the youth of the selected colleges, engineering colleges of Vadodara city, Gujarat. Sample size, it should be 60 students of the selected engineering colleges of Vadodara city. Sampling techniques is, so in that I using the non-probability sampling technique, in that I applying the purposes sampling technique. There is a description of the tool. So in that first, sir, I using the structured knowledge questionnaire to which consists of two sections, section A and section B. Before that, sir, I using the dichotomous questionnaire to identify the how who youth become using the excessive web series. So in that I using the dichotomous 20 questionnaires should be used. In that if there's more than 10 scores should be there, so I should be included in my sampling. Then I in the section A, in that using the demographic, in that including the demographic data, that including the age, gender, type of family, number of siblings, present residence, educational status, as well as the mode of internet access. In this section B, it deals with the structured knowledge questionnaire about the prevention and management of ill effect of the web series. So it contains the 30 questions. In that about the web series, that is a 2 questions, that is the introduction portion. Then psychology effect of the web series, that about the prevention and management, that including the 14 questions. Physical effect, in the physical effect and prevention and management is about the 11 questions, and social effect of the web series, it contained the 3 questions. So total 30 questions should be included in the section B. Next one is the analysis and interpretation. So according to the assessment of the categorization of the knowledge score in the pre-test and post-test. So pre-test knowledge score, if the good knowledge score is about the 6.67%. After the post-test, that is a 63.33%. Average knowledge, that is 61.67. And after administrating the self-instruction module, post-test should be 30. And poor knowledge before the self-instruction module is about the 31.66. After the administrating the self-instruction module is about the 6.67. Second table, so it should be so that, sir, before the administrating the self-instruction module about the prevention and management of the ill effect of the web series is more in the post-test. Second table, that mean difference and standard deviation, as well as the t-value of the pre-test and post-test knowledge score. The samples of the prevention and management of the ill effect of the web series. So that is one of the table that is also show the mean as well as the mean difference and standard deviation. So pre-test mean, that is 11.97, and post-test mean, that is 18.36. That is the mean difference between the pre-test and post-test. It's about the 6.41. And calculated t-value, that is a 12.188, and tabulated t-value, that is a 2. That is that is so that difference obtained from the mean pre-test knowledge score and mean post-test knowledge score was real difference. It should be not by chance. So that's so that here the calculated t-value is more than the tabulated t-value. That is a proof that the self-instructional module is more effective to improving the knowledge for the prevention and management of the ill effect of the web series. So there is a other graph that is show the comparison between the pre-test and post-test mean. There is the overall mean of the pre-test, that is 11.95, we already discussed, and post-test, that is the 18.36. So difference between the mean difference between, that is a 6. And there is a t-value comparison. So calculated t-value that is a 12.188 and tabulated t that is a 2. That is so that calculated t-value is higher than the tabulated t-value. So the last table that is so that association between the pre-test knowledge score with the demographic variable. So in that, sir, out of the 7, there are 6 significance in the result. That is the age, gender, siblings, present residence, educational status, as well as the mode of internet access. Next one, that is a discussion about the study. In this study, the researcher had administered the self-instructional module regarding the prevention and management of ill effect of the web series to improve the knowledge of the samples. The mean post-test knowledge score was higher than the mean pre-test knowledge score with the mean difference of 6.41, which was the statistically proven. And it revealed that the self-instruction module was effective in terms of the increasing the knowledge of the samples. That is a conclusion of the study. That is also so knowledge deficit existed in the selected samples regarding the prevention and management of the ill effect of the web series before implementation of the self-instructional module among the youth of the selected engineering college. Inadequate knowledge existed regarding the prevention and management of the ill effect of web series. The mean pre-test knowledge score was 11.95 and post-test knowledge score is about 18.36. So that score is also so the self-instructional module is more effective. Sample gain the significant knowledge after they were exposed to the self-instructional module. So there is a net references should be using. Sir, I don't putting the book references here. Thank you, sir.
Okay. Yeah, thank you. One of the question there, okay, why you
Yes.
choosing purpose sampling technique there?
Shall we start? Document
Why you
CVC?
choosing keep silent?
Sir, before, yes, sir. Sir, I using
Yes.
the purpose or sampling because of before we taking the sample, we analyzing the how many youth should be binge watching the web show because of the note. So in that we sir using the dichotomous questionnaire to analysis the youth who are using the binge watching the web series. So in that
Okay.
purpose is sampling use because of the here the in the sample settings are I using the 4 colleges.
Okay.
So,
Then another question, you are selected engineering college only.
yes,
Why
sir.
you not selected nursing college also?
Sir,
Because we are yes, please.
sir,
Please
in the
continue.
nursing college, we use that is a professional course, but sir, many of the data that show the engineering students should be more watching the web show as compared to the other students. That's
Okay.
why, sir, I
Arts.
selecting the engineering colleges,
Okay.
sir.
And arts college student as well as commerce college also not
Yes, but sir, arts college students having
watching
the
maximum compared
yes,
to
sir,
engineering.
yes, sir, sure. But arts college students having the many of the apps would be not using by the arts college as compared to the engineering college students,
What
sir.
is the reason behind? And reason is there?
Because of the more knowledge regarding the social media, sir. I think so. According to the arts students, engineering students having the more knowledge regarding the social media. So many of the students would be using the social.
Engineering students are technically sound compared to other students. So that is
Yes,
the
sir.
maybe reason. Okay, thank you. Very
Thank you
nice
so much.
presentation.
Thank you.
Okay,
Thank
yeah,
you.
thank you. Okay. Okay, yes, next please. Shyam Sahu.
Yes, sir. Good morning, sir.
Yes, good morning. Please say your presentation.
The note sharing.
There is the option for share screen. You can share from this.
So here unsupported document type, please select an image or PDF document.
Actually, you are using mobile.
Yes, sir. Yes, sir. I am outside of
Yeah.
home. So not available laptops are now.
So after 1 hour, you can share my laptop.
So I will try, sir.
Okay. Then
Okay.
you have to join. Okay. When you have available the system. Okay. Yes. Next, please, Mrs. Julia Chanu Di Chauhan.
Yes, sir.
Yes, Mrs. Julia, please share a
Yes, sir. Yes,
PPT.
I'm trying to share my screen, sir.
Yeah.
Sir, is it my screen can be seen?
No, ma'am. I'm not able to send you.
I don't know why I'm not able to share it.
Yes, then open your PPT there.
I'm not able to open only, sir. The PPT is already open.
So you go to share screen and there
Yeah, I'm going there only, sir.
use Alt tab. Continue. When your slide come, then you have to click there. Go to share screen, then click there and use Alt tab.
Yes, sir, definitely. Is it can be seen, sir?
Yes, it's done. Yes, continue, please.
Very good morning, sir. I
Yes,
myself,
good
Julia
morning.
Chauhan, Assistant Professor from Dinsha Patel College of Nursing. And today I'll be presenting my paper.
Yes, ma'am.
So is it my slide is sharing?
Yes, only slide one is visible. Use the
Yeah,
arrow key,
that's
cursor key is there. Yeah, or enter. Cursor key.
yeah,
Arrow
but it's
keys.
not happening. So same with Mohini Badia ma'am. It is happening for me as well.
Use escape, please. Use escape.
Yeah, I'm doing that only, sir, but it is not.
Escape. Use escape. Okay. Click on
Seconds.
escape. Press escape there. Then continue. Escape.
Yes, yes, sir. That only I'm doing, but it is not happening only.
Okay, please try now.
Sir, it's not happening. I'm so sorry for that. Maybe it's a network issue.
Again, share your slide. Then.
Yeah, I'll just stop sharing and I'll share it again.
Yeah. Okay, then just move the cursor or arrow key for next slide.
is not happening, sir.
Madam, you first of all, hello,
Hello, yes, sir.
madam, you first of all raise the escape. Then after you have to share the share screen.
Okay.
Press escape again. So your slideshow should be closed there. Them send like Mohani madam.
Sir, escape only I'm trying, but it is not happening. That's the reason.
Daksha sir. Hello.
Yes, sir.
Sorry. Okay,
Sir,
madam.
is it
Yes,
on
this
him?
is.
Okay, okay.
Yes. Continue.
Okay, thank
Yeah.
you, sir. Okay, thank you,
Yes.
sir. Sorry, sir.
Okay.
Myself, Julia Chauhan. I am an assistant professor in Dinsha Patel College of Nursing. And the statement of my today's paper presentation is a study to assist in knowledge of primary school teacher regarding selected behavioral problem among children in selected school of Nariad city with a view to develop an information booklet. And for the introduction, I have put behavioral disorder typical develop mostly in the childhood and adolescence. While some issue make me normal for children, but those who have behavioral disorder develop chronic pattern later on, such as like aggressive, defense, disruption, and hostility. Their behavioral causes can cause problem at home and school and can interfere with relation with others. So that's the reason I have chosen this statement. The
Okay.
objectives of my studies are to assess the knowledge of primary school teacher regarding behavioral problems among children, to find out the association between knowledge score with selected socio-demographic variables, and to develop an information booklet regarding behavioral problem and their preventions. Assumption, according to my study, the primary school teacher may have some knowledge regarding behavioral problem among children. Development of information booklet based on the assist knowledge regarding behavioral problem and their prevention among children with their school teachers knowledge in preventing behavior problem. The operational definition, what I have kept are knowledge, behavioral problem, some of the selected behavioral problem. Among that, I have kept ADHD, conduct disorder, and temper tantrum. So knowledge here defined as the information, understanding, and skill that we gain through education and experience. And behavioral problem, as I already mentioned, I have doing under some selected behavioral problems. So ADHD, conduct disorder, and temper tantrum. So ADHD, the full form is attention deficit hyperactivity disorder. It's a chronic mental disorder of an individual who is charged with constant activeness and restlessness behavior that make him or her extremely difficult to listen, pay attention, and stop his or her implosive behavior and manner. Conduct disorder refers as the child will behave antisocially by breaking the other property, frightening with others, truancy from school and home, fire setting, aggression towards people and animal. Temper tantrum is unplanned outbursts of anger and frustration. Tantrum can be physical, verbal, or both. So, and the children refer here falls under the category of 6 to 12 of age. An information booklet referred to a form of booklet which contain more information regarding selected behavioral problem and their prevention among school-going children. And the primary teacher here refers to those teacher with professional qualification who handle classes or who comes under the category who are taking the classes under 1 to 8 standard of the student. Review of literature, I have included review related to behavioral disorder among children and review related to knowledge of primary school teacher regarding selected behavioral problem among children. So here is one of the study I have kept as an example. This is also this was also a descriptive study which was conducted among the primary school teacher. Quantitative approach, descriptive research design were used, and convenient sampling technique were used on 10 government primary school, and the sample size were 19. And the knowledge of the school regarding assist regarding nail biting, eating disorder, mental retarding, social school phobia, autism, and aneurysms through a self-administered questionnaire. The study finding revealed that majority 73% of the teacher had moderate knowledge, but 21% has good knowledge regarding childhood behavioral disorder. The study shows that the maximum of primary school teacher had moderate knowledge regarding childhood behavioral disorder. And this is my research methodology. Research approach, I have used quantitative research approach. Research design, I have used descriptive research design. Population, the target population of the study were the primary school teacher who are teaching 1 to 7 standard in selected school in Nariad city. Setting of the study was carried out at selected primary school at Nariad city. Sample size were 100 and the sampling technique which I have adopted was convenient sampling technique. This is a systematic or diagrammatic representation of my study, and the description of the tool I have divided into section A and section B. Section A consists of socio-demographic, which consists of only 10 questions, whereas in the knowledge assessment, section B consists of structured knowledge questionnaire, and for this technique I have used self-administered questionnaire. Inclusion criteria primary. Sorry, sir.
Yes, continue.
Yeah, inclusion criteria, primary school teacher who are willing to participate in the study, teacher who are teaching from 1 to 7 standard only included. Exclusion criteria, primary school teacher who are not willing to participate in the study, primary school teacher who are not available at the time of data collection. Result and analysis. Data was analyzed by using descriptive and inferential statistic. Regarding gender, among the socio-demographic variables, I have selected gender and the subject thought, since there was a significant association in the gender and the subject thought. So regarding gender, majority were female with 83% and 17 were male. Regarding the subject thought, 64% were teaching teaching Gujarati, English, Hindi, and 16% were teaching math, 11 were teaching science, and 9 were teaching other subjects. So this is a graphic representation of the subject and the gender thought. And checking the knowledge assessment, out of 100 primary school teacher, one of them had inadequate knowledge, 24 of them had moderate knowledge, and 75 of them have adequate knowledge. It is inferred that among the primary school teacher, majority of them have adequate knowledge regarding behavioral problem. So level of knowledge here, gender and the subject thought, there was a significant association with the selected socio-demographic variable. So among all the demographic variables, the gender and the subject thought were having a significant association. So here is the chi-square value, and the table view is 5.99. Since the chi-square value is 6.88 for the gender, it shows there is a significant association. Whereas in case of subject thought, the table value is 12.59 and the chi-square value is 13.58. Since the chi-square value is high, it shows a significant association. This is the conclusion as well as the discussion I've combined. Out of 100 primary school teacher, 1% of them have inadequate knowledge, 24 of them have moderate adequately knowledge, and 75 of them have primary school teachers who are having adequate knowledge. And the present study revealed that the socio-demographic variables such as age, gender, religion, educational qualification, year of experience, type of family, marital status, number of children, subject thought, have you attended any training program regarding behavioral problem, had influence on association knowledge score of the primary school teacher. Hence, the study concluded that health professional who work in school should take responsibility to improve the knowledge of teacher in the area behavioral problem among children. So teachers should give more importance to the behavioral modification of the children. So these are some of the references which I have followed. So thank you very much, sir, for this opportunity.
Okay.
Yes.
Madam, one of the question there.
Yes,
You
sir.
selected primary school teachers. Audible?
Yes. Yes, sir.
Okay.
Yes, sir.
So in primary school teacher, you selected government or private school, or which type? Which school you
Sir,
cover?
I have not mentioned because I have mixed it up like the government and the private. So I have not
if you
specified whether it should be a government or private. So preferably we have gone for the sample collection we have maintained for the private only, sir.
okay, you have taken only private.
Yes, but it is not mentioned specific, but the more
Yeah,
since the
yeah.
availability more were the private, so we have gone to the private only, sir.
Okay, okay, that's good. Okay, thank you, ma'am. Thank you.
Yes, sir. Thank you, sir.
Okay, yes, thank you. Okay, yes, next, please. Madam, you can close your now. Yes, next, please, Mrs. Gohil Shivangi.
Good morning, sir.
Good morning.
Sir, is my slide visible?
Yeah, yes, 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 please continue.
May I start, sir?
Yes,
Good morning, sir. Myself, Shivangi Gohil. I'm going to present my research today.
yes, continue, please.
The research problem statement is a study to evaluate the effectiveness of plant teaching program on knowledge regarding chemotherapy and its adverse effects among staff nurses in selected hospitals of Ahmedabad, Gujarat. As we know, the cases of cancer is increasing day by day. And in year 2018, cancer was the second leading cause of death globally. Research which is published recently by Apollo Hospital states that India is now been declared as cancer capital of the world. Now we use radiation therapy and chemotherapy for the treatment regimen of cancer patients. And chemotherapy is a kind of treatment that uses drugs to attack cancer cells. And they have potentially hazardous effects on the cells, not only on the cancer cells, but as well as the normal cells also, which contributes to development of adverse drug reaction, side effects, and toxicity. Now, nurses, as we observe patients on the daily basis, so it is very important for the nurses to have adequate knowledge regarding chemotherapy and its adverse effect, so as to provide quality patient care and to reduce cancer patients' suffering. Now, statistics of many studies, national and international, shows that nurses have inadequate or poor knowledge regarding chemotherapy and specifically adverse effect of the chemotherapeutic drug. So, I have selected this study. Objectives of my study were to assess the pre-test knowledge score regarding chemotherapy and its adverse effect among staff nurses in selected hospitals of Ahmedabad, Gujarat, to assess the post-test knowledge score regarding chemotherapy and its adverse effect. Third objective was to evaluate the effectiveness of my planned teaching program on knowledge regarding chemotherapy and its adverse effects among staff nurses in selected hospitals of Ahmedabad, Gujarat, and to find out association between pre-test knowledge score regarding chemotherapy and its adverse effect and selected demographic variables of staff nurses. The null hypothesis states that there is no significant increase in post-test knowledge score after administration of planned teaching program regarding chemotherapy and its adverse effect. The research hypothesis H1 states there is significant increase in post-test knowledge score after administration of planned teaching program regarding chemotherapy and its adverse effect among staff nurses. And H2 hypothesis states that there is association between pre-test knowledge score regarding chemotherapy and its adverse effect and selected demographic variables of staff nurses working in selected hospitals of Ahmedabad, Gujarat. I have divided my review of literature into three parts. The first one was review literature related to prevalence of chemotherapy induced adverse effect. A study conducted in Delhi, private hospital, it states among 1000 patients, 570 patients had induced minor adverse drug reaction, and 10 patient was reported with very severe cardiac related toxicity induced by chemotherapy drug. Second review literature was related to nurses' knowledge regarding chemotherapy and its adverse effect, and the third one was related to effectiveness of plant teaching program and structured teaching program related to chemotherapy and its adverse effect on knowledge among staff nurses. The research methodology which I have used is I used quantitative research approach with one group pre-test, post-test research design. The independent variable of my study is plant teaching program on chemotherapy and its adverse effect. The dependent variable is knowledge among staff nurses. There were 6 demographic variable in my study: age, gender, professional qualification, clinical experience in oncology department, and total clinical experience of the staff nurses. And if any of the participants have attended any conference, workshop, or in-service education related to chemotherapy and its adverse effect. Research setting was I conducted my main study in Sterling Cancer Hospital and HCG Cancer Hospital, Ahmedabad, and I did my pilot study in Zydus Cancer Hospital, Ahmedabad. My target population was staff nurses who were working in hospitals of Ahmedabad, Gujarat, and accessible population was staff nurses who were working in selected hospitals of Ahmedabad, Gujarat, and who were accessible or available during my data collection time. Sample size was 60. I used non-probability convenience sampling technique, and I used structured knowledge questionnaire for collecting the data. The content validity was obtained by submitting it to 10 experts in the field, and the reliability of tool was measured by Carl Pearson's formula of correlation coefficient, which was found to be 0.80. Description of my tool. The tool was divided into 2 parts. First was having demographic data. The second was having questionnaire related to structured knowledge, related to chemotherapy and its adverse effect, which were having 2 questions from introduction and definition of the cell cycle. Second, normal cell cycle and how the cell division is there, and the role of chemotherapy in cancer care, the principles of chemotherapy administration, routes of chemotherapy administration, safety measures or safe handling of chemotherapy practices, classification of chemotherapeutic drug, and adverse reaction or side effects of common chemotherapeutic drugs. Totally 30 questions were there. Analysis and interpretation. This is frequency and percentage-wise distribution of staff nurses based on demographic data, which shows most of the nurses were belonging to the age group of 21 to 30 years. Most of the staff nurses were female. If we talk about the professional qualification of staff nurses, 37, which is highest in the frequency, were having professional education of GNM. Most of the staff nurses had their clinical experience in oncology department for 0 to 3 years, and most of the staff nurses had 20, which is 23, having the 9 years or above clinical experience, and none of the participant has attended any theoretical knowledge or any training regarding chemotherapy and its adverse effect. This is frequency and percentage distribution of pre-test and post-test knowledge score measured by structured knowledge questionnaire regarding chemotherapy and its adverse effect among staff nurses, which shows before administration of plant teaching program, staff nurses, 626 staff nurses had poor knowledge regarding it. 34 staff nurses had average knowledge, and after administration of plant teaching program in the post-test, none of the staff nurses had poor knowledge, and 37 staff nurses had average knowledge, and 23 staff nurses gained good knowledge regarding chemotherapy and its adverse effects. Mean difference, standard deviation, and Z-test value of the pre-test and post-test knowledge score of staff nurses. It shows after administration of plant teaching program, there is 7.56 mean difference in the pre-test and post-test knowledge score of staff nurses. The calculated Z value was 11.12 at 0.05 level of significance, and degree of freedom 59, which is higher than the table value, which is 1.65, which suggests the null hypothesis was rejected. Discussion of my study. The present study was conducted to evaluate the effectiveness of plant teaching program regarding chemotherapy and its adverse effects on knowledge among staff nurses working in selected hospitals of Gujarat. A supported study was conducted by Indravati Rao in Surat, Gujarat, which was again on the structured teaching program regarding antineoplastic drugs and their knowledge, attitude, and safe handling by the staff nurses, which again showed the nurses had poor to average knowledge regarding it. And after administration of the structured teaching program, there was a significant increase in the mean post-test score. Conclusion, it was concluded that staff nurses' knowledge was increased after implementation of plant teaching program regarding chemotherapy and its adverse effects, and staff nurses gained significant increase in the knowledge, which shows that plant teaching program was effective and it is acceptable and useful method for teaching for the staff nurses. These are some of my references, sir.
Okay,
Thank you.
good. You selected convenient sampling technique, right?
Yes, sir.
Why you chosen this technique?
Sir, I have selected convenient sampling technique because of the limited time availability, as well as we were selecting only oncology hospitals only. So I selected the samples who were available during the time of data collection.
Okay, and you collected 60 samples, right?
Yes, sir. Yes, sir.
So how you getting the data? Like because two hospital are there,
Yes, sir.
then equally 30
No, sir.
collected.
Sir, in Sterling Cancer Hospital, they were having the staff, 67 staff nurses. So I took only 20 samples from there. And in HCG, they are having 140 plus staff nurses. So I got my 40 samples from HCG Cancer Hospital.
Okay, 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 okay. That's good. Okay. Thank you so much, ma'am. Thank
Okay, thank you, sir. Thank you so much.
you. Okay. Yes. Next, Mrs. Ambika C.
Yes, sir. Good morning.
Yes. Good morning, ma'am.
Sir, I'm unable to share the screen because the other participant is sharing. Can you please?
Shivangi.
Yes, sir.
Shivangi.
Yes, sir.
Please, can close your slides. Share screen. Close your screen. Okay. Yes. Yes, ma'am. Please continue.
Please wait, sir. I'll. So please wait. I'll be presenting
Hi.
soon.
It's okay, ma'am. No problem.
So I'm searching for the document, but
Okay.
it's not seen. Unsupported document. So it is telling that unsupported document type.
Okay. If you didn't able to find, then you have to take your time. Not an issue. I will continue the next. Then when you get your support document, then you please let me know. Okay.
Okay, sir. Okay.
Okay. Yes. Next, Mrs. Ramandeep Kaur.
हाँ जी सर गुड मॉर्निंग
Yes.
सर
Good morning, madam.
सर
Please,
can I present with the help of I am presenting with the help of laptop but there is some technical issue so I will move my camera towards the laptop and then present.
Okay. Okay. Continue.
Okay sir, thank you.
First of all, show your face because it's all our recording process.
Yes sir,
Then
I am doing.
then move toward.
Sir, it's unable to. Sir, I am unable to show my camera. I don't know why. Start.
Then how you can show your slide also?
So yes, there is some issue, sir. Only 1 second. I am trying to.
Madam, first of all, you have to only touch your screen. Then two option is there, mute and start video. And you have
हाँ जी sir.
to touch start video. Then after you have to send your face.
Yes, sir. Start. I am clicking that. I think that is not in the setting, na. Start camera is not.
Okay.
Yes, sir. हाँ जी. Sir, give me time. Otherwise, I will.
Okay. Yeah. Please
Sir,
take
I
your
will.
time.
Okay, sir.
Okay.
Thank you.
Yeah.
Okay.
Next, Mrs. Patel Ria Jitendra Kumar.
Yes, sir.
Yeah. Yes. Please.
Good morning, sir.
Good morning.
Actually, why it's not?
Actually,
Yes,
yeah.
yes, yes,
Okay,
yes.
yes. Go for one slide one.
Okay.
Yeah.
Yes.
Yes.
Good morning, sir.
Yes. Good morning.
Myself, Riya Patel from Shri Umya KVC Nursing. Why it's not sharing? Okay, yes. Share.
Visible.
Done, sir?
Yes, visible. Not an issue.
Okay.
Just you have to change the
Uh,
slide one.
Okay, sure. First of all, my research statement is a study to assess effectiveness of plant teaching program on selected advanced contraceptives methods among married women in selected community area of Ahmedabad, District, Gujarat. Then, my introduction of the study, WHO surveys for the number of women desiring the use family planning has increased markedly over the past 2 decades from 900 million into 2000 to nearby 1.1 billion in 2020. An additional 70 million women are projected to be added by 2030. In India, only 12.9 percentage married women, all ages is 21 to 45 years, the unmet need for family planning. In Gujarat, Ahmedabad, most common use methods are used by the woman was intrauterine devices is 35.5 percentage and followed by oral combined contraceptive pills is 31.2 percentage and woman was contraceptive injections is 54.5, also we called as antra. In women, utilization of contraceptives were less because of lack of awareness and the fear of the side effects. Next, objectives of my study to assess the pre-test and post-test knowledge regarding selected advanced contraceptive methods among married women, to evaluate the effectiveness of plant teaching program on selected advanced contraceptive methods among married women, and third one is to find the association between pre-test knowledge with their selected demographic variables of married women. Then my hypothesis, null hypothesis, there will be no significant difference in the post-test knowledge score of selected advanced contraceptive methods among married women. Hypothesis one. Yes, sir.
Yes. Continue.
There will be significant difference in the post-knowledge score advanced contraceptive methods among married women. Hypothesis 2, there will be significant association of pre-test knowledge score of advanced contraceptive methods with their selected demographic variables of married women. Operational definition I use evaluate effectiveness, plant teaching program, knowledge, advanced contraceptive methods which I choose, and community area, setting of the urban area. Then review of literature. The related literature has been organized and presented under the following headings. 2.1 review of literature related to population. I choose 5 studies from that. 2.2 review of literature related to knowledge and perceptions of contraceptives. I choose 6 studies from the ROL. Review of literature related to practice toward contraceptives. I choose 9 studies. Then research methodologies. I use quantitative research approach, pre-experimental one group, pre-test, post-test research design I choose. Sample size was married woman who will be present at the time of data collection in selected community area. I choose non-probability convenience sampling technique. My independent variable is the effect of the plant teaching program, and dependent variable is selected advanced contraceptive methods. My demographic variable is age, education, occupation of this woman's, types of family income, number of child women have do you use any family planning method? Which of the following advanced contraceptive methods will you prefer in the future? And previously, knowledge regarding advanced contraceptive methods. Then, description of the tool. I use two main dividation. In the selection was section 1 is demographic data, or section 2 is self-structure knowledge questionnaires. This consists of 30 items. Section A, demographic data, which gives baseline information obtained from the married woman, such as age, education, occupation, type of family income, number of child. Which of the following advanced contraceptive methods will you prefer in future, and the previous knowledge regarding advanced contraceptive methods. Section 2 is the self-structure knowledge questionnaires, consist of 30 items, 30 questions, and the minimum score was 30. Every correct answer was given a score of 1, and the wrong answer given a 0. Then blueprint of my structure knowledge questionnaire, I use introductory question is 5. Then meaning or definitions of the advanced contraceptive methods is 2. I use injectable contraceptive questionnaire is 8. I use these 3 of the advanced contraceptive methods. Vaginal rig questions is 8, or hormonal skin implant questioning is 7. Total, I make 30 questions above my structure knowledge questionnaire. Then analysis and result. In the pre-score and post-score knowledge, I choose 3 criteria. First is poor knowledge, it between 0 to 10 score. Average knowledge is 11 to 20 score, and good knowledge is 21 to 30 score. Then first pre-score knowledge is frequency 32. Then average score is 28. Or then the post-test knowledge score, there is no poor knowledge in the woman. Then average knowledge is 50, and the other side, good knowledge is 13.3%. Next, this bar graph showing that my 3 of the pre-score and the post-score knowledge. Then mean difference, standard deviation, and t-test value of the test, pre-test, post-test knowledge. My pre-test score is 10.73 mean value, and standard deviation is 2.54. And post-test knowledge score is mean score is 18.63, and standard deviation is 1.79. Then my t-test value is 21.603, and degree of freedom is 59, and my table value is 2. So there are significance in my study. Then this bar graph showing the distribution of the pre-test and post-test knowledge scores. Then discussion of the studies, the researcher introduced herself to the participants, and objectives were explained, and informed consent was taken. I use informed consent for my research study. The study group is selected, and then pre-test conducted with the help of self-structure knowledge questionnaire, and regarding selected advanced contraceptives methods was conducted. On the same day, and the intervention and plant teaching program will be administered regarding selected advanced contraceptive methods to the study group. Then after the 7 days of post-test was conducted using the same structure knowledge questionnaires. The data identified from the present study shows that the mean pre-test knowledge score is 10.73. This finding indicate the need to develop a plant teaching program. In the present study, the investigator has developed a plant teaching program administered on married women in selected urban area at Ahmedabad city to improve their knowledge. And after administration of plant teaching program, mean post-test score is 18.63. Then conclude the analysis and interpretation of data collected from 60 samples before and after administration of a plant teaching program in terms of knowledge regarding selected advanced contraceptive methods among married women in selected urban area at Ahmedabad district, Gujarat. The mean post-test score was higher than the mean pre-test score value. The significance of the differences between pre-test and post-test knowledge scores was statistically tested using paired t-test, and it was found significant. It hence was provide that the plant teaching program was effective and increasing knowledge regarding selected advanced contraceptive methods among married women. So there was a significant association between family income, number of children, or the pre-test knowledge score. Hence, it was concluded that there is no significant association between demographic variable like age, educational status, occupation, type of family income. Do you know family planning methods? Which of the following advanced contraceptive methods will be preferred in the future, or previous knowledge regarding advanced contraceptive methods and pre-test post-test knowledge score? I use this bibliography from and the e-journals. Thank you, sir.
Okay, thank you, ma'am. One of the question, like your statement is selected methods only. You selected only 3 methods there.
Yes, ma'am.
Why chosen only this method only?
Because of
What
sir,
is the
in the
reason?
WHO survey, there are no effective knowledge regarding means lack of knowledge regarding advanced such of 3 advanced contraceptive methods, just like implantation, then vaginal ring. Also, they don't know about the government give the free injection like Antra. So I choose 3 of them.
Okay, that's good. Yes, okay. Thank you, madam. Thank you.
Thank you so much, sir. Have a nice day.
Okay, yeah, thank you. See you. Yes. Next, madam, please close your slides. Can close your issues. Okay, yes. Next, Diptanu Devarma.
Yes, sir. Good morning.
Yeah. Good morning.
Sir, I'm sharing my screen.
Hi, yes, sir. Yes.
Sir, is it sharing?
No, not visible, sir. Please click on share screen.
Oh, yes, yes.
Then you have to open your slide on folder or file. Yeah. Okay. Yes. Right now visible. Okay. You're handling. Yes.
Okay. Okay.
Okay.
So,
Yes.
a very good morning to all the respected dignitaries and the delegates. I am Mr. Diptanu Devarma, tutor in the Department of Medical Surgical Nursing, Tripura College of Nursing. And today I am here for my scientific paper presentation on effectiveness of muscle strengthening exercises on joint pain among the late middle age group in Bordoli Health and Wellness Center, Agartala, West Tripura. So this is the statement of my problem. At the introduction, so aging is the most important factor that leads to a decrease in quality of life relevant to biological, social, and psychological dimensions. According to Census 2011, the total population of Tripura was 36,73,917. The total population of middle age group, that is between 45 to 65 years of Tripura, was 5,81,658, which is a sharing of 15.82% of the total population. Joint pain results from cartilage damage that triggers a metabolic response at the level of chondrocytes. Progression of arthritis and osteoarthritis causes the normally smooth, white, translucent articular cartilage to become dull, yellow, and granular. Affected cartilage becomes gradually softer and less elastic and less able to resist or heavy use. So muscle strengthening exercises develop tension by holding the body in a certain position. Holding the muscle contraction allows the muscle tissue to fill with blood and create metabolic stress on the muscle. By applying constant tension to the muscles, muscle strengthening exercises can be useful for improving physical endurance and posture by strengthening and stabilizing the muscles. The objectives of my study was, number one, to assess the pre-existing level of joint pain among the late middle age group Number two objective was to evaluate the effectiveness of muscle strengthening exercises on joint pain among the late middle age group. And number three was to find out the association between pre-existing level of joint pain among the late middle age group with the selected demographic variables. The hypothesis of the study was all the hypotheses were tested at 0.05 level of significance. So research hypothesis one was the mean post-test level of pain score is significantly lower than the mean pre-test level of pain score. And research hypothesis two was there is a significant association between pre-test level of joint pain among the late middle age group with the selected demographic variables. In the assumptions, the study assumes that aging may rise to different joint pain. Number two, late middle age group may suffer from different joint pain. And the third one, muscle strengthening exercises may be one of the measures to reduce joint pain among the late middle age group. The literature of review of my study was divided into the two sections. In the section one, studies related to prevalence of joint pain among the middle age group, where 5 studies were included. And in the section two, studies related to effectiveness of muscle strengthening exercises in reduction of joint pain, where 5 studies were included. In the research methodology, the research approach was quantitative evaluative research approach. Research design was pre-experimental, one group pretest, post-test research design. Sample size was 40 samples of late middle age group. There will be the purposive sampling technique in my study, and the variables under the study, independent variable was the muscle strengthening exercises. Dependent variable was the joint pain among the late middle age group, and under the demographic variables, there are 20 criteria accordingly: age, gender, weight, type of family, marital status, educational qualification, occupation, monthly family income, food habit, type of daily activities at home, total number of family members staying with you, mention the musculoskeletal disorder, age of onset of musculoskeletal disorder, mention the location of, are you taking any medicine for joint pain? Are you taking any home remedy to reduce joint pain? If yes, mention the type of home remedy. Are you taking any alternative therapy? Are you doing regular exercises? If yes, type of exercise, duration of exercise. Do you have any information regarding muscle strengthening exercises? If yes, source of information. And the last one was, are you suffering with any other chronic illnesses? In the description of the tools, the tools of my study was divided into 2 sections. In the section 1, there is the tool 1, where is the socio-demographic proforma, which consists of 20 items, and the tool 2, that is the modified pain scale on joint pain, stiffness, and quality of life. So the sources of the tool were OMIC index, which is the Western Ontario and McMaster University's osteoarthritis index, which was developed at the Western Ontario and McMaster Universities in the year of 1982. The number 2 source was OMIC index, which was modified by CRD Pune, that was the Center for Rheumatic Heart Disease, in the year of 1986. And the third source was whose questionnaire, that was the knee injury and osteoarthritis outcome score, which was developed by Ua M. Rose and colleagues at the Department of Orthopedics at Lund University, Sweden, and at the University of Vermont, USA, in the year of 1995. In the analysis and interpretation of data, this is the table 1 showing frequency and percentage distribution of pre-test and post-test pain score, where in post-test, out of 40 samples, 15% of the samples had extreme pain, followed by 47.5% of the samples had severe pain, 30% of the samples had moderate pain, and only 7.5% of the samples had mild pain. Whereas in post-test, out of 40 samples, 0% of the samples had extreme pain, 20% of the samples had severe pain, 45% of the samples had moderate pain, and 35% of the samples had mild pain. So it indicated that muscle strengthening exercises were an effective measure to reduce the level of joint pain among the late middle age group. So this is the table for showing the mean, median, and standard deviation, mean difference, and t-value of pre-test and post-test pain score, where the post-test mean pain score was 34.27, which was lower than the mean pre-test level of pain score, that is 63.15, with the mean difference of 28.88. Whereas the post-test median pain score, that was 31.41, was also lower than the pre-test median pain score, that was 67.87. Accordingly, the post-test standard deviation was that was 12.94, which was less disparate than the pre-test standard deviation, that was 16.92. The pair t-test value was 8.59, which was significant at 0.05 level of significance, degree of freedom 39, table value 0.02. Hence, null hypothesis was rejected and research hypothesis was accepted, which indicated that muscle strengthening exercises were an effective measure to reduce the level of joint pain among the late middle age group. So this is the figure 25, where frequency polygon on pre-test and post-test pain score of late middle age group, where The post-test mean frequency polygon were lie on the left side of the pre-test frequency polygon. The the skewness of the post-test frequency polygon was positive, that was 0.6, and the pretest frequency polygon was negative, that was 0.8. So positive frequency in the post-test indicated that most of the samples had less pain than the average pain score of the group. In the figure number 26, whereas OGIF showing pretest and post-test post-test pain score of late middle age group, where in every percentile, every percentile, that is 25th percentile, 50th percentile, and 75th percentile, the mean pain score line or lie on the left side of the pretest mean score line. So it indicated that after the administration of the muscle strengthening exercises, there was reduction of the level of joint pain among the late middle age group. So this is the table 5 where ANOVA envelope association between pre-existing level of joint pain among the late middle age group with their selected demographic variables. So the data presented table 5 reveals that there was a significant association between pre-test level of joint pain among the late middle age group with the selected demographic 3.23, degree of freedom between group 2 within group 37, total number of family members staying with you, F value 3.31, table value 3.23, degree of freedom between group 2 and within group 37. Duration of suffering from joint pain, F value 5.52, table value 3.23, degree of freedom between group 2 and within group 37, which was significant at 0.05 level of significance. So it indicated has null hypothesis was rejected and research hypothesis was accepted, which indicated that the pre-existing level of joint pain among the late middle age group was dependent on the selected demographic variables. Whereas the study also indicated that there was no significant association between the pre-existing level of joint pain among the late middle age group with the selected demographic variables accordingly: age, weight, marital status, educational qualification, occupation, monthly family income, type of family, type of daily activities at home, mention the musculoskeletal disorder, age of onset of musculoskeletal disorder, mention the location of joint pain, are you taking any alternative therapy, source of information, are you suffering with any other chronic illnesses, at the 0.05 level of significance, hypothesis was accepted and research hypothesis was rejected, which indicated that the pre-existing level of joint pain variables. So in the discussion, the first objective was to assess the pre-existing level of joint pain among the late middle age group. So according to the conceptual framework based on modified Weidenbach's helping out of clinical nursing theory 1964, the researcher identified the pre-existing level of joint pain among the late middle age group by using modified pain scale on joint pain stiffness and quality of life. Through an interview schedule. The statistical findings of the present study revealed that the mean pre-test level of pain score was 63.15, followed by median pain score 67.87 and standard deviation 16.92. The present study was supported by the findings of the following study, as Divya in the year of 2019 conducted a study to assess the effectiveness of isometric exercises on level of joint pain among elderly in selected old age homes at Bangalore. Results showed mean pre-test pain level of knee joint pain among elderly in experimental group were 3.3 with the standard deviation of 1.3. In control group, the mean pre-test pain level of knee joint pain among elderly were 3 with the standard deviation of 1.14. The second objective was to evaluate the effectiveness of muscle strengthening exercises on joint pain among the late middle age group. In the present study, the hypothesis was stated as the mean post-test level of pain score is significantly lower than the mean pre-test level of pain score. The statistical findings of the present study revealed that the mean post-test level of pain score was 34.27 with the standard deviation of 12.94, was significantly lower than the mean pre-test level of pain score, that was 63.15 with the standard deviation of 16.92, with the mean difference of 28.88. The paired t-test value, that was 8.59, which was found significant at 0.05 level of significance, degree of freedom 39, table value 2.02. Of significance. The skewness of post-test pre-test frequency polygon was negative, that was minus 0.8, whereas the skewness of post-test frequency polygon was positive, that was 0.6, which revealed that the maximum samples had less pain score than the average pain score. The present study was supported by the findings of the following study, Babu J 2018, conducted
It's
study
not required. Okay. This is supported study.
Okay, sir. Yes, sir. Supported
Okay.
study.
Then leave it this one.
Okay, sir. The third objective was to find out the association between pre-existing level of joint pain among the late middle age group with their selected demographic variables. So the research hypothesis according to this objective was that there is a significant association between pretest level of joint pain among the late middle age group with the selected demographic variables. So in the present study, analysis of variance value showed a significant association between pretest level of joint pain among the late middle age group with the selected demographic variables according to type of family, total number of family members staying with you, and a duration of suffering from joint pain at 0.05 level of significance. In the conclusion, the present study was conducted to evaluate the effectiveness of muscle strengthening exercises on joint pain among the late middle age group. In the present study revealed that muscle strengthening exercises were an effective measure to reduce the level of joint pain among the late middle age group. Analysis of variance evaluation showed significant association between pretest level of joint pain among the late middle age group with the selected demographic variables such as type of family, total number of family members staying with you, duration of suffering from joint pain at 0.05 level of significance, which indicated that pre-existing level of joint pain among the late middle age group was dependent on the selected demographic variables. So this is the some list of references. So thank you, sir. Thank you all of.
Okay, thank you. One of my question,
Yes, sir.
like you assess the pen, how you can assess the pen? How you assess the pen?
Sir, yes, sir. Sir, for assessment of the pain, I used the modified pain scale on joint pain stiffness and quality of life. So this is the name of my pain scale. So I followed the 3 standard scales. So there is the omic index. Second one was the omic index, which was modified by the CRT Pune, and the Coos questionnaire.
Okay. One other question, like
Yes,
you
sir.
given muscle strengthening exercise.
Yes, sir.
How many days you given this exercise?
Sir, I demonstrated and give the exercises for 20 consecutive days for 30 minutes.
Okay, and after 20 days you get the positive result.
Yes, sir.
Okay, that's a good thing. Okay, thank you so much.
Thank you, sir.
Okay, thank you. Yes, next please, Mrs. Swapna Das. Mrs. Swapna Das, available? Okay, Mrs. Swapna Das, available? Okay, Mrs. Rathod Falguni. Mrs. Somya Menon.
Yes, sir. I'm
Please mute yourself, all participant.
Yes, sir. I'm Sapna Das, and can I do my presentation right now?
Please open your video.
Oh, okay, sir. Sir, is it visible? Sharing on the screen?
Yes. Your video, please continue open your video during presentation.
Okay, sir. Good afternoon, one and all present here. Myself Shapna Das, and I want to present a research study on a study to assess the knowledge regarding diaper rash and diaper hygiene practice among mothers of diaper wearing child in selected hospitals at Agartala with the view to develop an information booklet. So introduction is diaper rash is one of the most common problems among infants and toddlers, and it is most commonly caused by irritations in the diaper area. The rash usually evident in the abdomen, genitalia, and inside the skin folds of the thighs and buttocks. Diaper rash typically occurs in infants and children younger than 2 years. Almost every baby gets diaper rash at least once during the first 3 years of life, with the majority of these babies 9 to 12 months old And this is the time when the baby is still sitting most of the time and is also eating solid foods, which may change the acidity of the bowel movements. The objectives of my studies are: first objective is to assess the knowledge regarding diaper rash and diaper hygiene practice among the mothers of the diaper wearing child. And second objective was to find out the associations between the knowledge regarding diaper rash and diaper hygiene practice among the mothers of the diaper wearing child with their selected demographic variables. The hypothesis of these studies was hypothesis one: significant associations between the knowledge of mother regarding diaper rash and their demographic assumptions. The knowledge of mothers regarding diaper hygiene practice will reduce the incidence of diaper rashes in children. And second assumptions was distributions of information booklet will improve the knowledge of mothers regarding diaper hygiene practice. Operational definitions. First operational definition is assess. In this study, it refers to evaluate the knowledge of mothers of diaper wearing child regarding diaper rash and diaper hygiene practice. And next is second operational definition is knowledge. In this study, it refers to response of the mothers of diaper wearing child regarding diaper rash and diaper hygiene practice. Operational definition of diaper. In this study, diaper refers to type of materials that allows to urinate or defecate without the use of a toilet by absorbing or containing waste products to prevent soiling of outer clothing and external environment. In this study, both homemade diaper and commercial diaper are included. Fourth operational definition is diaper rash. In this study, it refers to rash, itching, and inflammations of the baby's skin. Then operational definition of diaper hygiene practice. In this study, it refers to uses of diaper, frequency of diaper change, and type of wipe use and using barrier product. Sixth operational definition is mother of diaper wearing child. In this study, it refers to mother of child who wear diaper belong to age group of 0 to 2 years of old. And last one is information booklet. The operational definition of information booklet, it refers to systematic development of information regarding the diaper rash and use of diaper and diaper hygiene practice, which will be distributed after the study. And review of literatures of this study, I have divided in 3 sections. First section, the study related to the prevalence of, and in the second section, the studies that are related to the knowledge of mothers regarding diaper dermatitis and diaper hygiene practice. And section 3, that included the studies related to the impact of diaper use among the child. The methodology of this study, methodology of this research study was research approach. Quantitative research approach was used in this study. Then research design was descriptive research design, and sample size was 82 mothers of 0 to 2 years of diaper wearing child. And sampling technique used for this study was purposive sampling technique. And the variables of these studies was research variables that are knowledge of mothers regarding the diaper rash and diaper hygiene practice. And demographic variables for these studies was age of mothers, age of child, education status, educational status of mothers, occupations of mothers, and place of residence. Then family income, type of feeding, type of wife, type of diaper, onset of using diaper, then frequency of diaper change, previous incidence of diaper rash, and uses of barrier product. Descriptions of descriptions of the tools in these studies. The structures interview schedule on knowledge of mothers regarding the diaper rash and diaper hygiene practice. And tools was divided in 2 parts, section 1 and section 2. In section 1, there was background information. Part 1, demographic data, and part 2 was practice profile. And in section 2, knowledge of mothers regarding the diaper rash and diaper hygiene practice. Knowledge questionnaire was used for this section. And the variables was for the demographic, for the background information, demographic variables was used, and for second section 2, knowledge questionnaire was used. And technique of the data collections was questioning. Now comes to the analysis of these studies. So the statistical analysis of this study, these tables that reveals the percentage distributions of level of knowledge regarding diaper rash and diaper hygiene practice among mothers of the diaper wearing child. So out of 82 mothers, 48 mothers, they have moderate knowledge regarding the diaper rash and diaper hygiene practice. And out of 82 mothers, 34 mothers have adequate knowledge regarding the diaper rash and diaper hygiene practice. And maximum score was 39 and minimum score for this study was 1. Now, area-wise mean percentage of knowledge score regarding the diaper among mothers of in this table, it reveals that the highest mean score, 82.66% mothers have knowledge regarding the signs and symptoms of diaper rash. And 29.67% of the mothers have knowledge regarding the preventions and treatment of diaper rash. Regarding the maximum of the mothers have knowledge regarding the signs and symptoms of the diaper rash, and they have less knowledge regarding the prevention and treatment of the diaper rash. And this table that reveals the association between the knowledge score of the mothers regarding diaper rash and diaper hygiene practice with their selected demographic variables. So this table that reveals that the mothers, there is significant associations between the knowledge of mothers regarding diaper rash and diaper hygiene practice with their selected demographic variables such as educational status of the mothers, then occupations of the mothers, then place and residence of the mothers, and previous incidents of diaper rash. And there is no significant associations between the knowledge score of the mothers regarding diaper rash and diaper hygiene practice with the selected demographic variables like type of feeding of diaper change. So in this study, the null hypothesis was rejected and reserve hypothesis was accepted for the educational status of the mothers and occupations of the mothers and place of residence of the mothers and previous incidents of the mothers regarding the diaper rash. And discussion of these studies, the findings of the studies was discussed, the findings of the study discussed were based on the objectives and the hypothesis and conceptual framework of the studies. So objective 1 was to assess the knowledge regarding diaper rash and diaper hygiene practice among the mothers of diaper wearing child. So the statistical findings of the study revealed that 58.54% had moderate knowledge and 41.46% had adequate knowledge. The present study was supported by the findings of the following study. Panjal D et al. Conducted a study regarding the descriptive study to assess the knowledge regarding preventions of diaper dermatitis and among the mothers of 0 to 3 years of children residing in Ahmedabad city with a view to develop an information booklet in Ahmedabad city, Gujarat, India. The study revealed that 61% of the sample had good knowledge and 37% had average knowledge and 2% mother had poor knowledge. Objective 2, to find out the associations between the knowledge regarding diaper rash and diaper hygiene practice among the mothers of diaper wearing child with their selected demographic variables. The statistical findings of the study revealed that there were significant associations between the enrolled schools with educational status, occupations, place of residence, and previous incidence of diaper rash at 0.05 level of significance. And therefore, the null hypothesis was rejected for the demographic variables, educational status, occupations, and place of residence, and previous incidence of diaper rash and research hypothesis was accepted for this variable. The
Okay,
present
thank
study
you.
was supported by the findings of the following study. According
Madam,
to
please, you continue for only, don't explain regarding supported study. Okay.
okay,
Only share detail regarding
sir.
your conclusion or result. Yes.
Okay, sir. Okay. The
Next
conclusion.
slide. Hi. Yeah. Okay. Done. Okay. Thank you, ma'am. One of the question there, like you selected 82
Yes,
samples,
sir.
right?
Yes, sir.
So what is the reason behind you select exact 82?
Yes, sir.
You selected 82 samples there.
Yes, sir.
So what is the reason behind you selected this only, not 180 and that all? Any specific reason there?
My target population was at 100 sample, but during the COVID period, I have done this study. So due to that, there was only 82 sample available there. So I have collected this 82 sample only for my study.
Okay, good. Yeah. Thank you, madam. Thank you.
Okay, thank you, sir.
Okay. Yes. Next, please, Rathod Falguni Mohandas, ma'am.
Okay.
Rathod Falguni, ma'am. Available? Okay. She is not. Then Soumya Memon, ma'am. Okay. Vara Lakshmi.
Sure.
Okay. Yes, ma'am.
Sir, Soumya Menon is available.
Hi. Yes, ma'am.
Yes, sir, I'm available.
Hi. Yes, ma'am. Please share your screen.
Is screen visible, sir?
Hi. Yes, ma'am. Yes.
Good afternoon, one and all. First of all, I would like to thank Noble Nursing College, Gujarat, as well as NTAI and NSS for giving me this opportunity to present my oral paper presentation. And I would like to present a paper on assessment of health-related quality of life among women with HIV/AIDS and its association with demographic variables. For the introduction or the need for the study, we know that HIV, the virus that causes AIDS, is one of the most serious public health challenges across India as well as world. At the end of 2022, there was an estimated 39 million people living with HIV, out of which 53% were women and girls. In India, annual new infections are estimated at 62.97 thousand in 2021. The number of people living with HIV are estimated at around 24 lakhs, with southern state having largest number of people living with HIV, namely Maharashtra, Andhra Pradesh, and Karnataka being the top three. As per the data provided by NACO 2021, 10.50 lakhs women were living with HIV in India. Women living with HIV experiences mental issues like stress at higher rates compared to their male counterparts, or HIV non-infected women due to various reasons like gender disparity, social stigma, etc. These issues not only affect their quality of life, but also compromises HIV management and transmission prevention. Hence, I had selected this study to identify what is the health-related quality of life among women living with HIV/AIDS and in the selected city of Maharashtra, and what is its association with the demographic variables. So the objectives for my study was to assess the health-related quality of life of women living with HIV/AIDS, and also to find association between health-related quality of life with selected demographic among women living with HIV/AIDS. Before undergoing this study, the literature review was done based on the following areas, that is literature related to disease burden of HIV/AIDS, literature related to physical and psychosocial issues affecting health of people living with HIV/AIDS, literature related to health-related quality of life among people with HIV/AIDS. For the research methodology, the research approach and design selected was quantitative approach, non-experimental cross-sectional design. Variables under the study were health-related quality of life and also the demographic variables. Research setting was ART Center of selected city of Maharashtra. Samples were women diagnosed with HIV/AIDS who are visiting selected ART center for their treatment, and sample size was estimated to be 255. Sampling technique which was selected was non-probability convenient sampling technique. The criteria for sample selection included inclusion criteria, the women living with HIV/AIDS who were in the age group of 18 to 45 years of age and who had after 2 months of initial diagnosis of HIV positive were selected for the study. And also the women who were able to read, understand and speak English, Hindi and the local language Marathi. Exclusion criteria where the women who are having cognitive or communicative disabilities were excluded from the study. Working as commercial sex workers were excluded from the study, and also women who are hospitalized and are HIV positive were excluded from the study. The tool or instrument used for the study was a standardized scale, that is a WHO QOL HIV breath scale, and the validity was established by giving it to expert in the field of nursing and psychology. Also, the reliability of WHO QOL HIV breath scale was rechecked and it was found to be 0.86 and which was found to be acceptable. Description about the tool. Tool contains two sections, that is the demographic data, and the tool section B, that is related questions related to the health-related quality of life. The demographic data comprised of demographic details like age, education, marital status, religion, occupation, duration of illness, and the source of infection. Whereas section B, it consisted of WHO QOL HIV breath scale, and this scale was used particularly to assess the quality of life of the samples. And it is a standardized scale which is provided by WHO, which is a multi-dimensional instrument consisting of 31 items in which respondents rated the frequency of their feelings and thoughts related to events or situation. It basically comprised of 6 domains of physical health, level of independence, psychological health, spirituality, social relations, and environmental health. And each item was rated on a 5-point Likert scale ranging from 1 to 5. The method of data collection was undertaken after obtaining permission from the concerned authority, and the samples were selected and informed consent were taken from them. The research tool was provided to the sample and they were asked to fill the data as per their experiences, and filling of the scale approximately took 10 minutes by each sample. Coming to the results and the discussions. So demographic variables results reveal that majority of the samples were in the age group of 40 to 45 years, whereas in education, it was revealed that majority of the samples had completed secondary level of education. Regarding the marital status, it was revealed that majority of the samples were in the married category, that is 40.4%, and also majority of samples were belonging to Hindu religion. And also for occupation, majority of samples were in the housewife category. That is around 51% of the samples were in the housewife category. The data related to the duration of illness. So it was revealed that majority of the samples, that is 62%, said that they were tested positive more than 7 years back. And also related to the awareness about from where they got the infection, that is a source of infection. Majority of the samples reveal that is 39% reveal that they were not aware about their source of infection. Results related to the quality of life. So it was revealed that after analysis, the domains the domains under which the quality of life was distributed was physical, psychological, level of independence, social relationship, environmental and spirituality. And after the analysis, it was revealed that minimum quality of life was found in the domain of social relationship, and which was followed by spirituality domain. And acceptable or better quality of life was found in the domain of physical domain. So this was the data related to the mean and the standard deviation under each domains. The next objective that is related to association between related quality of life and demographic variables of the woman. So it was revealed that there was a significant association seen between age of the woman and the environmental health, environmental domain. Significant relationship was seen, and also related to health-related quality of life and demographic variable. It was seen that there was a significant association seen with occupation of women, that which demographic variable, and the domains physical health, level of independence, and environmental health. Hence, the discussion and the conclusion goes that the findings of the study suggest that interventions to improve the social support and spiritual well-being may be beneficial for these women living with HIV/AIDS. These may compromise their overall health status and the quality of life. Additionally, there is a significant association seen between women's occupation and her physical health, level of independence, and environmental health. This highlights the importance of addressing occupational factors that may be impacting their quality of life. And also the further research is needed to identify specific interventions that can improve the social, spiritual, and occupational well-being of women living with HIV/AIDS that may in turn help them to improve their quality of life. And even today in our country, measures need to be adopted to increase public awareness regarding the disease so that the affected individuals can live with a better quality of life. So these are the references for my study. And here I conclude my paper presentation. Thank you.
Okay, thank you, ma'am. And one of the questions regarding like how you collected the samples.
Sir,
Like
it
you
was
collected.
it was by a convenient sampling method. So the women who are visiting the ART center for their therapy or for taking the treatment, they were approached, and the women who were giving the consent for participating in the study were selected as the samples.
Okay, through ART centers. Okay, that's good. Thank you so much, ma'am. Thank you.
Thank you. Thank you, sir.
Okay. Yes, next, Vara Lakshmi, ma'am. Available? Ma'am,
sir.
please exit your paper. Vara Lakshmi, ma'am, is available? Vara Lakshmi, ಎಲ್ಲರೂ. Okay. Miss Parita Bhatt.
Before that, Himanshu Trivedi is there.
Okay, yes.
I am
Yes, sir.
presenting. Thank you.
Yes, sir. Thank you, sir.
Hello, sir.
Himanshu Trivedi. Himanshu Trivedi.
Hi, yes, sir. Sir, please continue.
No.
Sir, are you sharing from your side?
No, from your side, sir.
Actually, this Rakshesh sir is open this?
Yes, sir.
Okay,
Can I share,
please.
sir?
Hi, yes, sir, please.
1 minute, sir.
Ha, yes, sir.
मैडम આપણે हिमांशु सर ने शेयर करो.
Hi, you have to open
Seema
this.
madam, will we
Click.
share the Himanshu sir PPT?
Hi, yes, sir. Yes, sir. Please double click on the slide. It will be open there. Seema madam, are you audible?
Yes, sir.
Yes.
एक मिनट क्या चाहिए?
Okay, yes, visible, sir. Sir, please continue.
I will check.
Can you do
Yes,
the
yes, sir.
presentation? Can you do the whole slide?
Sir,
F5?
it is,
Just
yes,
F5?
Daksha sir, please press F5.
Yes, sir. Yes, sir.
A very
Yes,
good
sir,
morning,
visible.
a very good morning and wonderful good afternoon to everyone here. Thank you to the Nobel University, Nursing Teacher Association, Nursing Scholars Society for conducting such a great scientific presentations. I am here with my co-author Parita Bhatt for this scientific paper presentation. Parita Bhatt is also available, and myself Himanshu Trivedi is our main author for this research study and dissertation. So we are here presenting the scientific paper, a study to evaluate the effectiveness of guided imaginary therapy among the hypertensive geriatric patient at selected area of Ahmedabad city. So this is for our study we have started to do very back soon before 2-3 months only we completed. And the guided imagery, I just wanted to explain the guided imagery is what it is want to say. The image of managing, it's a methods of managing the stress. Guided imagery therapy is a relaxation technique that involves imaging positive, peaceful setting, sitting, sleeping peacefully, and imaging in a favorite peaceful setting as a beach meadow for the reducing hypertension. So it's a one kind of technique that we can manage the stress of the patients. And by doing this relaxation technique on the patients may have certain sorts of reducing the hypertension level. So this is a in beach meadow for the reducing the hypertension level. Yes, next, sir. So we have assessed, we have find the objectives before starting this study. So to assess the effectiveness on hypertension geriatric patient with guided imagery therapy in an experimental group, assess the effectiveness on hypertensive geriatric patients without guided imagery therapy in control group. So both group we have been divided. So compare the effectiveness of guided imaginary therapy on geriatric hypertensive patients in experimental group as well as in the control group. Both we have again we compare the data, and again we have find out the associations between the effectiveness of guided imaginary therapy with the selected demographic variables in the experimental group. Yes, sir. So we have found the hypothesis in this case. There will be no significant difference between the guided imagery therapy in both experimental group and the control group. There will be H1 is there will be a significant difference between the guided imagery therapy in both experimental group as well as in the control group. So that was the hypothesis we started to doing on that. And we have found certain operational definitions. You all know about this. Evaluate effectiveness. Evaluate in this study. Evaluate refers judge or determine the significance. Effectiveness. We are finding the effectiveness refers to the capability of producing desired results. Guided imagery. I was just wanted to focus on that, especially that what is guided imagery. So in this study, guided imagery therapy is a method of relaxation which concentrate the minds on positive images for 10 to 15 minutes and attempt to reduce the hypertension. So that's the main operational definitions we have been identified for this study. In hypertension, in this study, the hypertension means blood pressure is greater than or equal to 140 90 mm of Hg. What is geriatric in that study? Geriatric means age more than or equal to 60 years. Len must be a living in the Ahmedabad city only. So patients in this study, the patient means who are having the hypertension and receiving the guided imagery therapy, and we have selected the samples accordingly too. Yes, sir. Next. I think the slide was
Sure.
no.
Dakshit sir.
Sir. Actually, I'm sitting in different areas, sir.
Okay. Sure, sir.
Okay, not an issue.
Okay.
Yes,
So
sir,
we
please.
have found
Sir, I will.
review literature for
Yes,
this.
visible, please.
Yeah, visible. Review literature, we have found this a cross-experimental study versus the effectiveness of guided imagery based on the spiritual care on stress level of blood patients and hypertension patient. Was author was having the Agustina Equati et al. And study design, they were having the quasi-experimental, and they have collected the data from the intervention group, was given guided imagery on a spiritual care of 15 to 20 minutes, and the control group was given standard interventional usual care for the 1 week. The variable study was stress level and the blood pressure. They were having the 34 samples collected through the purposive sampling technique, and we have been collected with the convenience sampling technique. So that was the review literature we have found, and many others review literatures also we found related to the guided imagery therapy. Yes, next sir.
Praveen sir, please mute yourself.
Yes, another study results, the analysis used the Wilcoxon sign rank test for the pre and post testament, as well as the Mann-Whitney test, determine the difference between the intervention group and the control group. With a significant value of less than 0.05, the results of the analysis systolic blood pressure using the Wilcoxon sign rank test showed a p-value of 0.001 in the intervention group, and p-value was a 0.564 in the control group. So result analysis diastolic blood pressure using the Wilcoxon sign rank test were a p-value of 0.003. In the intervention group, the p-value was a 0.046 of control group. So these results are analysis using Mann-Whitney obtain a p-value of 0.00 stress. Systolic blood pressure and p-value of 0.0 and the diastolic blood pressure p-value of 0.0 between the intervention group and the control group. So this is another review of literature we have been found on the Wilcoxon sign rank. Yes, sir. Methodology. We have decided to do the method research approach, that is a quantitative study, and research design. We have started with the control and experimental group. In that quasi-experimental study, we have started selected setting was there, the old age home in Ahmedabad city, populations, old age home, hypertensive patient, sampling technique, non-probability, and it was a convenience sampling technique, and we were having a sample size of 50. The tool data sheet were measured by the hypertensive patients. We have, yes, next. The demographic variables. In that demographic section 1 and section 2, we were divided, and demographic variable in the questionnaire, which has considered the age of geriatric patients, gender, marital status, religion, stages of hypertension, substance abuse, lifestyle, physical exercise, preventing of complications, taking regular prescribed medication. And in the second sections, the data consists of where the measurement of hypertension data work we were entered in that. And the results, yes, next. These are the sections wise we have taken the socio-demographic variables and geriatric hypertension experimental group and geriatric hypertension control group. Comparisons we have more. This whole objectives we have cleared, we made identified here in we have done that results also. So next results. Can you please? So this was the main results of our study, the comparison of post-test hypertension level between the experimental group and the control group in terms of systolic, diastolic, and mean arterial ratio was calculated by independent t-test we have done. And in that, we have identified the mean score of post-test of experimental group, and systolic blood pressure was 129 plus minus 9.20. The mean score of post-test control group systolic blood pressures was 142, 132 plus minus 12.98. Independent t-test was a 4.1885 and degree of freedom was 48 and the p-value of less than 0.001. The mean score of post-experimental group diastolic blood pressures is 82.76 plus minus 4.27. The mean score of post-test control group diastolic blood pressure was 79.84 plus minus 7.597. Independent t-test was 1.579. The degree of freedom was 48, and as p value was 0.121. The mean score of pre-test and experimental group was mean arterial pressure, that is a 98.16 plus minus 5.82. The mean score of post-test control group was systolic. Again, the mean arterial pressure was 100.68 plus minus 7.09. The independent t-test was 1.372, degree of freedom was 48, and the p-value is equal to 0.177. So that's why I have written in one slide only, because I was not able to already I was guided by a lesser number of slides. So I have description accordingly the results. So that only the very good results we have been found, and really we got a great things in that. The discussion based on the objective study and hypothesis. The study was designed to evaluate the effectiveness of guided imagery therapy among the geriatric patient at selected area of an Ahmedabad city. That is, we have already selected, that was an old age home. In quantitative research approach was used in post-experimental design. The target populations for the study was hypertensive geriatric. This population was selected by non-probability convenient sampling as previously discussed, and the total sample under the study were 50 geriatric patients. Geriatric hypertensive patient was our total samples. Next. So study result concluded the guided imagery therapy was effectiveness to reducing the hypertensions in the experimental group. So that's what we got good results for the guided imagery. And these are the bibliographies we have identified from the LH2 and Hart and Young Copsons and Harry Gardner, guided visualizations, John P. Tuna and Karen Gap have been identified from various resources, and many other resources we have been identified. And here Parita is also there with me. Thank you, Parita, for being with us and done the results study. Yes.
Thank you so much, sir. Thank you, sir.
Yes, sir. Okay. Is there any doubt in that, or we can clarify? Yes, Abhinav, sir? Okay. Nothing. Thank you. Thank you for considering my scientific paper presentation. Thanks to the team of NTI, NSS, and the Noble University.
Thank you so much, sir.
Thank you, sir.
Abhinav, sir. So next one is
Hello.
Hello.
Yes, Parita ma'am, are you available? Na?
Yes, sir. I am available.
Okay.
Good
Daksha, sir,
afternoon,
please
sir.
share the good afternoon, madam.
Sir, can you share my slides?
Yes.
Yes. Okay. Thank you, sir.
Yes, please continue, ma'am.
Yes. Good afternoon, one and all. Thank you, Noble University, to give this kind of the platform for the scientific paper presentation. As I am Parita Bhatt, Assistant Professor from Narayan Shastri Institute of Nursing. Next slide, please. Okay, my problem statement was a quasi-experimental study to evaluate the effectiveness of oil massage on weight and sleep pattern among the low birth weight babies in selected hospitals of central Gujarat.
Please, next.
Next.
Dakshas sir, please change the slide.
Hello. Next slide, sir.
I will change.
Next slide. Yes, madam, continue your objective.
Yes. I can visible, sir.
Continue. Yes,
Introduction.
continue your objective.
Baby massage could baby massage could potentially benefit for. Hello.
Yes,
Okay.
audible.
Next slide,
audible.
sir.
Next slide, please. Yes, continue.
But I
Further,
can't
ma'am.
see my slide, sir.
Actually, you already shared all our display visible.
Yes, sir. The first objective is to assess the weight and sleep pattern with the oil massage in the experimental group, to assess the weight and sleep pattern without oil massage in control group, and third is to compare the effectiveness of oil massage on weight in experimental group as well as control group, to compare the effectiveness of oil massage on sleep pattern in experimental group and control group, to find out the association between the sleep pattern and selected demographic variable in the experimental group. These are my objectives. Next slide, sir. And the hypothesis was there is no statistically significant difference between the weight gains in the both groups at the level of 0.05 significance. There is no statistically significant difference between the sleep pattern in the experimental group and control group as well as at the level of 0.05 significance. Next slide. Operational definitions. Evaluate. First one is evaluate. Evaluate means the impact of recent changes in the study. To evaluate refers to measure the effectiveness of oil massage between the experimental group as well as control group. Coconut oil. In this study, oil refers to as a sticky liquid substance of coconut oil. I used 15 ml oil regularly till 7 days for the LBW babies for the massage. Then massage means rubbing of the muscles to reduce the pain, improve the growth and weight of the baby as well as sleep patterns, while the rubbing of the oil on the muscles and joints to improve the weight as well as sleep pattern. 2 times massage apply in a day for 7. Then weight gain in this study means weight difference between the day 1 and day 7 in both groups, experimental group as well as control groups. Next. Low birth weight babies weight between the 1.5 to 2.5 kg and admitted in the hospitals. Sleep pattern, I took 2 parameters for the sleep pattern for the assessment. First one is sleep duration and second one is sleep interruption. It means the number of minutes a child spent for the sleeping within first 8 hours after the oil massage. Then sleep interruptions. It means the number of times child wake up within first 8 hours after the oil massage. Next slide. Review of literature. The problem statement was the effectiveness of coconut oil massage on weight gain among the low birth weight newborns. That is, author is Evelgenia Salih Singh and study setting in Saudi Arabia. The study design was quasi-experimental. The tool described that first one is the demographic variable related to the mother, and second section, the including demographic related to the child, and third section, they using the infant weight scale. Then data collection method by the infant weight scale, and there was a 60 LBW babies they are taken. Next one. The study result shows that the mean value of 4.5 with the standard deviation of the 3.65 in the experimental group and the 2.3 mean with the standard deviation of 0.7 in the control group. And the calculated was the 3.21, which shows that
there is a significant difference between the experimental and control group at the p-value is less than 0.01 level. So they conclude that the finding of the studies reveal that there was a significant weight gain among the low birth weight babies who are received the coconut oil massage. Next slide. Yes, methodology. The research approach is quantitative, then research design is quasi-experimental. Setting is selected hospitals of central Gujarat. Population is low birth weight babies. Sampling technique was used non-probability convenience. Sample size is 60, 13 experimental group and 13 control group. In 30, we're applying the for 7 days coconut oil massage, and control group, there are no applying of the coconut oil massage. The tool I used, data sheet, where measured the weight and sleep pattern data would be entered. Demographic variables include demographic variable of the studies are weight of the baby, week of gestation, gender, Apgar score at the birth, mode of feeding, and age of child. Next one. Tool description, and they were divided into the two sections. The first section consists demographic variable questionnaires, which include weight of the baby, week of gestation, gender, Apgar score at the birth, mode of feeding, and age of the child. Then section 2 is consists the data sheet where data are entered of the weight as well as sleep patterns. Next one. Results are in the sixth section. The first finding is related to the socio-demographic variable. Second was finding related to weight gain and sleep pattern in experimental group. Third section, findings related to the weight gain and sleep pattern in control group. Section 4, comparison related to weight gain in experimental as well as control. And fifth one, comparison related to the sleep pattern in experimental as well as control group. And sixth section, finding related to the association between effectiveness of oil massage in sleep pattern and selected demographic variable in the experimental group. Next slide. The analysis, the chi-square calculated value corresponding to gestational age, weight of the baby, gender, birth order, Apgar score, mode of feeding, age of child. There are found the then greater than chi-square tabulation in maximum in mode of feeding. Hence, it concludes that there is a significant association between mode of feeding with the selected demographic variables. Chi-square calculated value corresponding to gestational age, weight of the baby, gender, birth order, Apgar score, mode of feeding, age of child, they found greater than chi-square tabulated maximum, same as a mode of feeding. There is a no significance association between the selected demographic variables. Next one. All our results shows that the weight gain is the 110 gram increase within the 7 days, and average weight gain is 15 gram per day. There is the standard deviation of weight gain also shows the effect of weight gain sleep duration after the oil massage is increased. The difference of sleep duration first to 7 days is a more than 30 minutes shows the effectiveness of oil massage, and sleep interruption into the sleep pattern of the experimental group. The value shows that the interruption of the sleep will reduce day by day. All our results shows that in control group, minimum improvement in the weight of baby without oil massage and sleep duration decrease day by day in the interruption increase day by day in the control group. Next one. They perform the Mann-Whitney test shows that mean value of the weight is experimental group is 11 and in control group 0.18. Standard deviation is 0.14 in experimental group. In 15 in control group, Mann-Whitney test is 47. There is a significance relation with the weight gain between the experimental group and control group because the p-value is less than 0.01 because it decreased the 0.05 level of significant. Then Mann-Whitney test shows that mean value of experimental group in the sleep duration is 28.73 and 35.5 in control group, and standard deviation is 55.89 in experimental group and 48.14 in control group. Mann-Whitney test value 167. There is a significance relation sleep duration between the experimental group and control group. P-value is the less than 0.01 value because it decreased than the 0.05 level of significant. Mean value is a sleep interruption is 0.27 in experimental group and control group 1.87 standard deviation significance relation with the sleep interruption between the experimental group and control group. The p value is 0.393. Next one. The study conclude that there are effectiveness of the oil massage to increase the weight and sleep pattern. Thank you.
Okay.
There are some
Thank you, ma'am.
references. Yes, thank you, sir.
Okay. Like you chosen oil massages. The how many days required to oil massages for baby
To
increase the weight and that all thing?
For my study, I used only 7 days because it's a short duration of the time for my study. So it's I choose the 7 days for the maximum to give the weight gain, to check the weight gain.
Okay. Yeah. Thank you. Thank you.
Yeah. Thank you, sir.
Okay.
Thank
Next, Mr. Rohit De. Mr. Rohit De.
Mr.
Is
Rohit,
not available.
are you ready?
Mr. Rohit,
He
are you
is not
hearing?
for that, sir.
Not
So
available in group? Okay, next, yes, Mrs. Ramandeep Kaur, ma'am.
हाँ जी सर,
Ma'am,
गुड
are
आफ्टरनून
you?
सर.
Good afternoon, ma'am. Yes,
हाँ जी सर,
please
आई एम
share.
रेडी.
Yes,
यस
ma'am.
सर.
Ma'am, you have available your PPT or will share?
Sir, I am trying to share, but earlier there was
Okay,
problem again.
Dakshish sir.
Yes,
Dakshish
sir.
sir.
Yes,
Yeah,
yes.
please share the
My side.
madam. Yeah,
Yes, sir.
from your
Please,
side.
sir. Yes, sir.
Ramandeep Kaur.
हाँ जी सर.
ये 4-5 नंबर पे है सर. सर नीचे ऊपर स्क्रॉल कीजिए. ये रहा 6 नंबर. यस.
Yes, sir.
Please press F5.
Yes, sir. Anji. Good afternoon to all of you. So myself Ramandeep Kaur Bajwa. I am working as nursing officer at CSC Kalanar Gurdaspur, Punjab. So my problem statement is, sir, kindly go to the back slide, first number slide. Yes. So
और बैक कीजिए सर. एक
Anji.
और.
Yes, yes. Okay, sir. Thank you, sir. So, so research statement is a knowledge and practice among staff nurses regarding COVID-19, a cross-sectional survey from Punjab. Next slide, sir. Introduction. In earlier December, first case of pneumonia of unknown cause was originated in Wuhan, capital city of China. The pathogen identified was named as novel coronavirus, which was then called as severe acute respiratory syndrome coronavirus 2, an enveloped and single-stranded RNA virus, which has pathological resemblance to SARS-CoV-1. Next slide, please, sir. Next. Then, aim of the study. The study was aimed to identify the current status of knowledge and practice regarding COVID-19 among staff nurses in Punjab. In addition, study has highlighted the information sources utilized by staff nurses. Next, need of the study. Knowledge, attitude, and practice survey provides a suitable format to evaluate existing programs and to identify effective strategies for behavior change in society. Therefore, this study was aimed to identify the current status of knowledge and practice regarding COVID-19 among staff nurses in Punjab. And in addition, study has highlighted the information sources utilized by staff nurses. Next, sir. Then methodology. So research approach used in my study was quantitative research approach. Research design used was cross-sectional design. Research setting was Punjab. Target population was staff nurses. Sampling technique used was purposive sampling technique. So a cross-sectional survey-based study was conducted during the month of August to September 2020, days of strict lockdown to implement social distancing to avoid spread of pandemic. As it was not feasible to conduct population-based survey in this critical condition, the investigators selected an online data collection method. Survey was started on 28th August 2020 and response acceptance was closed on 28th September 2020 when required sample size was achieved. Next. Sample size was 220 staff nurses. Research tool used in the study was a questionnaire which was designed on Google Forms and link was generated and shared on WhatsApp groups of staff nurses. Link was also shared personally to staff nurses who were in contact list of investigators. Sir, I want to clear this as ये स्टडी मैंने खुद ही की है एज आई वाज वर्किंग इन रजिंद्रा हॉस्पिटल पटियाला at tertiary level hospital. So I was the main author. So तब strict lockdown का time था. So I have used this method. So practically I have done this, and I have done
Okay,
so
so
much.
have you collected samples?
Yes, sir.
Data collection
Yes, sir. हाँ जी.
by Google
Sir,
Form.
yes, sir. Google Form. I have generated a
But
link.
you have communicate with all staff member.
Yes, sir. Actually, we have various work groups of staff nurses.
Okay.
Like under here in Punjab, yes, there are two main, governments, two branches of government under DRME and DHS. Both are government branches and central government. And we are having alag groups, separate groups. And I have shared all my information in groups in WhatsApp and through my friends, colleagues. And therefore, I have collected by data by this method.
Okay, that's good.
Next.
Yes, continue.
Yes, sir. Yes, sir. Then results and discussion. So demographic characteristics of staff nurses, as most of the regarding gender, most of the staff nurses were for female, that is 87.7%. Age, most of the staff nurses was having age less than 30 years, that is 82.7%. Regarding qualification, majority of them has done BSc nursing experience. 38.6% of the staff nurses was having experience 1 to 3 years. The next slide. Source of information. Most of the staff nurses has used social media as a source of information in that time. As I have told you that at that time it was a strict lockdown. So most of the people has relied on internet, social media, and least of them has used radio, television, newspaper, etc. The next slide. And table 2 represent level of knowledge and practice among staff nurses towards COVID-19. So regarding level of knowledge, majority, like 78.2% of the staff nurses have good knowledge. And regarding practice, again, 97.7% of the staff nurses has good practice regarding COVID-19. Next slide, sir. Then knowledge of staff nurses regarding COVID-19. So these are the statements according to which I have analyzed the data and taken their score according to the knowledge level. So there are different statements as I have told in the previous slide, and that most of them was having good knowledge and practice regarding COVID-19. These are the statements like influenza virus and all. These are the statements according to which I have mainly analyzed. Like here, most of them has given correct answer related to the first statement, that is influenza vaccine also give immunity against COVID-19. Most of them was aware that no, this is not the right answer. Okay, so they have done cross, and similarly on the next statements, cross and right cross, they have done according to that. So next slide, please. Then table 3. Again, knowledge of staff nurses regarding COVID-19. Next, these are the continued question. Total 12 questions were taken and scoring was done according to that. 0 to 12 scoring. Hanji sir. Next. Then practice of staff nurses regarding COVID-19. So most of them was having good practice regarding COVID-19. Only one main factor was there that which hinders the practice. Like most of them do not throw the trash or extra paper or use material in the dustbin, and most of the staff nurses are not educating their patients about how to take care how to take care to prevent COVID-19 infection. These were the most hindrance factors. Then table 5 represents association of knowledge and practice with selected demographic variables of staff nurses. So this is association. The main is knowledge. Regarding knowledge, there is significant association of knowledge with the main factor, that is qualification. So on the other hand, regarding practice, there is significant association of practice of staff nurses regarding COVID-19 related to qualification as well as experience at 0.05 level of significance.
Okay. Next,
Hanji
please.
sir, next. Result, Hanji, same. Finding shows staff nurses have good knowledge, that is 78.2%, and good practice, that is 97.7% regarding COVID-19. Use of limited mask in crowds and do not throwing the used tissues in trash are the major barriers in infection control practices. Factors such as qualification was, so next slide, significantly associated with good knowledge at the level of 0.05. Also, there was significant relationship between qualification and experience with the practice of staff nurses regarding COVID-19 at the 0.05 level of significance. Next up, please. Discussion. So, staff nurses in Punjab have good knowledge reflected by good practice. Current findings of good knowledge among staff nurses is in line with findings of Geo et al., who reported that 88.4% participants have sufficient knowledge regarding COVID-19. Inclusion. Findings providing confidence as staff nurses have good knowledge, good practice regarding COVID-19. Study also able to highlight gaps in specific aspects of knowledge and practice that should be focused in future awareness and educational campaigns.
Okay. Thank you so
And
much, ma'am.
these are the references. Thank you, sir.
Okay. Yeah. Thank you, ma'am. Thank you.
Thank you.
Okay. Yes. Next, Radhesham is available. Mr. Radhesham, sir.
Falguni Rathod is available, sir.
Okay. Yes, please. Falguni Rathod, ma'am.
Yes, sir. Yes, sir.
Sir.
My voice is audible.
Yes.
Madam,
Shall I say
are you sure your side your PPT, ma'am?
yes, my side.
Okay.
Okay. Yes.
I will say
Please share.
my slide is visible.
Yes, ma'am. Yes.
Okay.
Please
Good afternoon.
on your video.
Okay, sir.
Yes. Please continue.
Yes. Today I'm present to scientific paper presentations. Good morning, sir, and all of you. My presentation topic is study to assess the level of knowledge and practice of self-administration of insulin among diabetes mellitus patients of tertiary care hospital, Vadodara and Gujarat. In this in this presentations, I will present the introduction, objective of the study, hypothesis, methodology, and result discussion, and the conclusions. In the introductions, I will discuss with these diabetes mellitus, what is the diabetes mellitus, and main problems is self-administration of insulins. For this, I want in the introductions, diabetes mellitus Chronic metabolic disorder characterized resulting from diabetes and insulin secretions, insulin actions, or both. With the estimated 37 million adults living with the diabetes worldwide, the condition poses a significant global health challenge with the profound implications for morbidity, mortality, and healthcare expenditures. The self-administration of insulin requires patients to have a comprehensive understanding of various aspects, including insulin types and formulations, proper injection techniques, doses, adjustment, storage requirements, hypoglycemia recognitions, and age management, and adherence to prescribed regimens. However, studies have constantly demonstrated gaps in the patient's knowledge and practice of insulin's self-administrations, which may contribute to suboptimal glycemic controls, increase the risk of complications, and decrease the quality of life. So, because of this gap, I taken this the statement. Next is objective of the hypothesis. There are three objectives. First one is assess the knowledge and practice regarding self-administration of the insulin among diabetes mellitus. Then second one is to find out the association between the knowledge and practice with the selected socio-demographic variables. And third one is find out the correlation between the knowledge and practice regarding self-administration of insulin. Then the hypothesis, there is a first one is a null hypothesis. There is a no significant association between the knowledge and practice with the selected socio-demographic variables, and the alternative hypothesis is there is a significant association between the knowledge and practice with their selected socio-demographic variables. Then research methodologies. My research design is quantitative, non-experimental, descriptive research design. Study setting is Dheeraj Hospitals, Piparia, Vadodara. Then sample is diabetes mellitus of Dheeraj Hospital, who are admitted in the Dheeraj Hospital only. Sample size is 300 diabetes mellitus patients, and then sample technique. Through this concert flow chart, we will see here. Assess the eligibility. मतलब कि patients I was taken the 311s. From the 311s excluded 11 persons who is not meeting with the inclusion criteria. Then I decided the randomly I select simple randomly technique. I selected 300 diabetes mellitus patients. In this 300 diabetes mellitus patients allocated with the all 300 diabetes mellitus patients, I given the self-structured questionnaire. Who is there is a 20 questionnaires, and one of these checklists in that 18-point scale checklist. Then the variables, there are two variables, research variables and demographic variables. In that research variables, which are the knowledge and practice of diabetes mellitus patients regarding self-administration of insulin, and the demographic variables is in this studies age, gender, education, occupations, duration of the diabetes mellitus, source of the information, and family history. In these tools, I was divided in the three sections. Section 1 is the demographic variables, then section 2 is self-structured questionnaires for the knowledge regarding the self-administration of insulin, and third section is checklist was used for the practice regarding the self-administration of insulin among diabetes mellitus patients. And then result and analysis. The frequency and percentage distribution of sample according to their characteristics. A significant portion of the study participants, specifically 44.67%, fell within the age of 51 to 60 years, and is term of gender, and majority 80% were male. Regarding the educational attainment, 52.33% of the participants had completed primary education. In the term of employments, 33% of the participants were unemployed. When considering the duration of diabetes mellitus, substantials 88% of the participants reported having had diabetes mellitus for a duration ranging from 0 to 5 years. Impressively, a significant 87.33% of the participants possess knowledge regarding related to diabetes mellitus. Interestingly, 51% of them had a specific source of knowledge about the diabetes mellitus. Additionally, Noteworthy finding was the majority of the study participant had a history of diabetes mellitus, emphasizing the prevalence of the condition among this group. Next one is a distribution of knowledge scores and practice score among diabetes mellitus patients concerning self-administration of insulin. In this knowledge scores, there is a two, moderate and adequate. Moderately, frequency is 270 and percentage is 72.33%. Mean score is 10.88 and standard deviation score is 0.5017. Adequate in the adequate knowledge scores, frequency is 83 and percentage is 27.66%. And there is a mean both these moderate and adequate, mean and standard deviation scores is given here. Practice score, I was divided in three criteria: poor, average, good, and excellence. Here there is mean is 2.30 and standard deviation is 2.5749. Then in second sections, association between the knowledge scores and specific demographic variables is what, highlighting that amongst these demographic variables, in that only education was the only one have found a significant association with the knowledge scores, rather than the other variables are not significant with the knowledge scores. Next one is a relationship between the practice score and specific demographic variables. It is important to note that significant demographic variables that displayed an association with the practice score encompass educations, occupations, and the source of knowledge only significant. Other than the other variables are not significant with this practice score. Conversely, the remaining demographic variables were determined to non-significant concerning practice score. Third section is, for this I was used the Carl Pearson correlation coefficients. Here I written this. There is a mean score of mean knowledge scores, mean practice score, total number of the samples 300, correlation coefficients is 0. minus 0.004. So this evaluated that no any correlation between the knowledge score and practice score. Discussion of this study. The finding from the current study disclosed that when considering the demographic variables based age, gender, occupations, duration of diabetes mellitus, source of knowledge, family history, etc., they found to be not significant influencing knowledge scores. However, education showed a significant association. Only from this only education showed a significant associations. Regarding practice scores and demographic variables, significant association were observed with educations, occupations, and source of knowledge. Only significant others variables are not significant with this practice score. It is noteworthy that there was no apparent correlation between the knowledge score with the practice score in the context of self-administration of insulin among diabetes mellitus patients. This implies that an enhancement in knowledge scores is likely to result in improved practice among diabetes mellitus patients when it comes to self-administration insulin. Then conclusions. In conclusion, this study has found the knowledge and practice regarding the self-administration of insulin among diabetes mellitus patients do not exhibit a significant correlations. Therefore, it is imperative to prioritize effort to enhance both knowledge and practice in this regard to facilitate better self-administration of insulin among the participants. To achieve this, it is recommended that healthcare professionals, including doctors, nurses, play active role in educating patients during each hospital follow-up visit, providing essential educations and basic knowledge about self-administration of insulin can significantly contribute to improving the practice of diabetes mellitus patient in this regard. And all are the reference for this study. Yes, I'm.
Okay. Thank you so much, ma'am. Such a nice presentation.
Yes.
Thank you so much. Okay. Next, now.
So it's my time. Jaspal Singh.
Mr. Jaspal Singh. Yes.
Yes. Kindly share my.
Daksha sir, please share. Sir, you haven't your PPT?
Sir, I already sent.
શું નામ છે?
Jaspal
Singh.
Singh. नीचे होगा ये रहा. 15 number 15.
Yes. Time it.
Yes.
I'm audible, sir?
Yes, sir. Yes, sir.
May I start? Kindly start my PPT, please.
Please double click on those PPT.
Sir, I will try, but
It's technical problem. Sir, you haven't. If suppose you have available, then you can share. It is good for.
Sir, visible?
No, it's this one. You can't share by Zoom.
सर एक्चुअली अभी इन्होंने शेयर किया हुआ है तो शेयर नहीं हो रहा, एक साथ में एक ही स्क्रीन शेयर हो सकती है. That's why. I will share it. Can I start, sir?
Yeah, okay. That's sir, you exit the.
Okay.
Share
Yes,
link.
sir.
Share. Then okay, Jaspal sir, please share now.
Okay, sir. Just 1 minute, please, sir.
Now you can start, sir.
Yes. Visible.
Okay, sir. My name is Jaspal Singh. Today I present my topic. First of all, my statement is a comparative study to assess the level of anxiety before examination among GNM students in a selected nursing institute, district Patiala, Punjab, a view to develop an information pamphlet. First of all, introduction about my study. Anxiety is an emotion characterized by the feeling of the tension, worried thought, and physical changes like increased blood pressure prevalence rate among the students before examination, according to the large population-based survey, up to the 33.7% of the population is affected by the anxiety disorder during their lifetime. In a cross-culture comparison, prevalence rate are highly variable. Exam anxiety can be caused by various factors among the students, like a poor study habits, poor test performance in the past, fear of the failure, lack of preparation, striving of the perfection, low self-esteem, depression, fear of making poor grades or letting down. Limited socialization or social skills also cause anxiety among the students before examination. Sometimes they are learning disability, ADHD, and other conditions that impact the performance of the student can cause anxiety. Objective of my study to assess the socio-demographic variable among the nursing students of the selected nursing institute district Patiala, Punjab. Second objective is to assess the level of anxiety before examination among GNM fourth year students of the selected nursing institute district Patiala, Punjab. Third one is to assess the level of anxiety before examination among the GN third year student of the selected nursing institute district Patiala, Punjab. Fourth one is to compare the level of anxiety before the examination among GNM first year, GNM third year students of the selected nursing institute, district Patiala, Punjab. Fifth one is to find the association of the level of anxiety before the examination, GN first year and GN third year student of the selected Nursing Institute, District Patiala, Punjab, to develop the distribute information pamphlet on coping strategies of the anxiety among GN first year and GN third year student, selected Nursing Institute, Punjab. Operational definitions assess the systematic collection.
Okay,
Sir, I'm
skip
audible?
operational definition. Yes, sir. Skip operational definition. Okay.
Assumptions of
Please
this study.
go. Please go for next slide.
Review of literature. The relevant review of literature is available on Google, PubMed, on other sites. Methodology.
Okay.
Main part of
Yeah.
my
Okay.
study is the methodology. The research approaches was quantitative research, then comparative research then was used. Comparative research time was used to assess the level of anxiety before examination among the nursing students. Research variables knowledge regarding the level of anxiety before examination and socio-demographic variables among GNM first year and GN third year students of the Adarsh College of Nursing, Patiala, Punjab. Dependent variables self-structure questionnaire on the level of anxiety before examination. Independent variable informational pamphlet. Research setting. The study was conducted in Adarsh College of Nursing, Patiala, Punjab. Target population, the population of the main study comprised GN first year, GN third year students of the selected Adarsh College of Nursing, Patiala, Punjab. Sample size, the sample size of the studies comprised of 40 nursing students. Likewise, 20 students of GN first year and 20 students of GN third year selected nursing college, Adarsh College of Patiala. Sampling technique, simple random sampling technique was used to selection of the sample. Description of the tool, the self-structure questionnaire was developed in the order to maintain the data. Tool was prepared after reviewing the related literature and after consultation with the expert. Research tool consists of the two sections. Section 1, socio-demographic variable. Section 2, in the self-structure questionnaire to assess the level of anxiety before examination. Scoring procedure in a self-structure questionnaire, there have 14 questions and each question have 5 options such as a never, rarely, often, little bit, frequently, always. The range of the assessment categorized as they follow. 1 to 70 is mild, 18 to 35 is a moderate, 36 to 52 is a severe, and 53 to 70 is a extreme. Maximum score is a 70 and minimum score is a 1. Analysis and results. Assess the level of anxiety before examination. GN first year student, table number 3 is drawn, and level of anxiety among GN first year students. Mild 1 to 70 is a 0%, moderate 80 to 35 is a 16 to 80%, severe 36 to 52 is a 1 and 5%, extreme 53 to 70, 3 to 15%. Assessing the level of the before examination among GN third year students, table number 5. Level of anxiety among GN third year students, mild is 1 to 70 is a 2%, 10%, and moderate is a 18 to 35, 14 students, and 70%. Severe is 36 to 52 is 3 to 15%, and extreme 53 to 70 is a 1, 5%. Mean and median range, mean score of the GN first year students, mean score is 32 to 15, and standard deviation is 11.109, median is 29, and maximum is 59, and maximum is 18, and range score is 41. And mean is, meanwhile, 30 GN third year, mean value is 31.1, and ST is 9.38, median is 28, maximum 53, and maximum is 15, and range score is 40, and mean percentage is 44.42. Discussion. The present was conducted to evaluate the level of anxiety among the students of the GN first year and GN third year of the selected Nursing Institute of District Patiala, Punjab, with the view to develop the information pamphlet. The finding of the studies has been discussed with the reference to the objectives. Conclusion of my study: the exam anxiety can be caused by the various factor among the student, like a poor study habits, poor test performance in the past, fear of failure, lack of repetition, starving of the perfection, and the low self-esteem, depression, fear of making poor grades, of the letting down. Because of nursing student will be a tomorrow full-fledged attendant who will participate in the bedside. Level of anxiety among GN and first year student maximum will up to 45%. Hello. We 16 to 80% had a moderate level of the anxiety. 3 to 15% of the student had an extreme level of anxiety. 1 to 5% have a severe level of anxiety, and 0% had a mild level of anxiety. The level of anxiety before examination among GN and third year student, maximum student is of 14, and 70% has a moderate level of anxiety. 3 to 15% had a severe level of anxiety, and 2 to a 10% had a mild level of anxiety, 1 and 5% has an extreme level of anxiety. This study has not only improved the knowledge of the student, it could be considered as a part of the continuing professional development of the student in all aspects. The level of anxiety can be reduced by providing them the knowledge about how to deal with anxiety by introducing them about the coping strategy through the informational booklet or pamphlet. Thank you. Hello.
Yes, sir.
Okay, sorry. Sir, which tool you used for assessment of anxiety level?
Self-structures tools used here.
Sorry, actually, yes, please.
Self-structure tools.
Okay.
Hello,
Okay.
sir.
Thank you.
Yeah.
Yes, yes. Okay, yeah. Thank you so much, sir. Thank you. Okay, next, Mala Devani, ma'am. Are you audible?
Ready, sir.
Yeah, please share your favorite.
Yes, sir.
Ma'am, you have to share your side, ma'am. Okay.
Yes, sir.
Okay, okay, ma'am.
And dear participants, it's request to all of you, please follow the timeline limit and maintain.
Sir,
Okay,
am
because
I audible?
yes, 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 yes.
Okay,
Yes,
my
please continue.
screen can be seen
Well,
by
yes,
all.
yes, ma'am. Your voice is audible, your screen is visible. Yes, yes, ma'am.
Yes, sir. So should I start?
Yes, sir. Yes, ma'am.
Yes, yes.
Thank you, sir. Myself, Mala Devani, currently working as a nursing tutor at General Nursing School, Surendranagar. My today's paper presentation statement
Please,
is,
sorry, ma'am. Please on your video.
hello.
Please on your video.
Okay. Today's my scientific paper presentation statement is a study to assess the knowledge
Please
regarding
on your video.
video. Okay, sorry. 1 minute,
Video
sir.
also. Because all thing is recording. Yes, please continue. Yes, please continue.
Okay, 1 minute, sir.
Yes, ma'am, your PPT is visible. Please start.
Sir, just 1 minute. I am not able to see here.
Can I share, ma'am?
Just 1 minute.
Okay, ma'am.
Okay, ready. Okay. Okay, so my topic is a study to assess the knowledge regarding emergency drug among staff nurses working in ICU of selected hospital of Junagadh. The introduction for this study is emergency nursing is nursing specialty in which nurse care for the patient in emergency or critical phase of their illness or injury. Emergency nurses frequently contact patient in emergency department before the patient sees a physician. In this situation, the nurse must be skilled at rapid, accurate physical examination, early recognition of life-threatening illness or injury, and the use of advanced monitoring treatment equipments. And in some cases, the ordering of testing medications according to advanced treatment guideline or standing orders set out by the hospital emergency and physician staffs. Objective for study is to assess the knowledge regarding medical emergency drugs among staff nurses of ICU working in selected hospital of Junagadh city. So assumptions for this study is the staff nurses of ICU possesses some knowledge about emergency drugs which is used in critical care units. Operational definition for this study is assess. The assess is the process to find out the knowledge of emergency drugs. Emergency drugs, also known as emergency medicines, is the medical specialty involving care of undifferentiated and unscheduled patient with illness or injury requiring immediate medical attention. Staff nurses. For my study, staff nurses are defined as the nursing staff who are working in ICU of selected hospital of Junagadh city during the time of data collection. Knowledge. Knowledge is a familiarity and awareness regarding medical emergency of drug among staff nurses. Review of literature. We have taken very much review of literature. Among that, one study I have shown here. Methodology. So descriptive research design with the survey approach is chosen. Purposive sampling method we have selected. A variable for this education and experience are of the staff nurses are the dependent variable. Description. We have two sections in the tool. Section 1 shows demographic characteristics of participant. It deals with the personal information, which includes 4 items such as age, sex, qualification, and clinical experience. Section 2. That was the structure knowledge questionnaire. It deals with the knowledge regarding emergency drugs among staff nurses who are working in ICU. Hello.
Yes, Ma'am, continue. You continue.
Okay, so demographic data, we find that our 21 to 30 years staff nurses, we got 56, 31 to 40 years, 3 staff nurses, 41 to 50 years, 1. And above 50 years, we haven't included any staff nurses. Qualification, we got GNM 35 staff nurses, BSc nursing 5, post basic 3, and ANM 17 staff nurses because we have included private ICUs also. Clinical experience wise, 0 to 3 years experience, 42 staff nurses are having, 4 to 6 years experience, 11 staff nurses were having, 7 to 10 years experience, 5 staff nurses were having, and above 14 year, it was 2 staff nurses. So we find the result that knowledge regarding emergency drug in majority, 38%, 38 staff nurses, it means 63.33% respondent have moderate, 11 staff nurses, It means 18.33% staff nurses knowledge respondent have poor knowledge, and 18.33 respondent have good knowledge regarding the drugs. So this is the result. So in study, we concluded that the knowledge in the form of experience or in the form of degree plays a very much role in nursing care, because staff nurses who are, we see in our study that the staff nurses who are experienced or staff nurses who are having upper degree like post basic and BSc nursing, they were having good knowledge regarding the drugs. Thank you.
Hello, very good afternoon, Mala. So,
Good afternoon, sir.
this is Dr. Binu here. Okay.
Yes, sir. Good
Okay,
afternoon,
Mala.
sir.
So, very nice study. Okay. So, what was the significance of the study? Can you tell me something about the significance?
Sir, we want to know that, sir, we wanted to know that the staff nurses who are working in ICU, they are capable of serving the drugs to the patient or not. That we wanted to know.
That is, you wanted to know what significance you got it from the study, your significant findings or something related to that. What does your findings says that?
Sir, that I already spoke about. There were 11 staff nurses who are having good knowledge. 11 staff nurses, they were having very poor knowledge. And rest of the staff nurses who are having moderate amount of knowledge.
Okay, Madam. So then what you want to recommend all the young researchers who are sitting here? What you want to recommend from this study? What made you to do this study, or what are the recommendations?
Sir, in this study, we have included government hospitals ICU as well as private hospitals ICU, which are available for us. So I recommended that this is a 4-year-old study. So recent study should be there. Second, I recommended that there should be in-service education program. Because knowledge refreshment is also necessary.
Okay, Mala. Okay,
Routine.
Mala. Point. Okay, Mala. So actually, you went for it. This was your UG study, or what was this study for? Which purpose? For what?
Sir,
You did it for?
sir, this was my UG students did this study, and I was a research guide.
You
This
were
study was done
research
by
guide and done by the UG students and all, you together as a guide for this.
yes,
Okay,
sir.
madam. Thank you. Thank you. Okay. Anyone
Thank
else wants to ask anything? Other? Okay. Thank you, madam.
Thank you, sir.
Next was the serial number. I have joined now only. So presenters, you know your serials. I was told that it was Amandeep ma'am. Amandeep ma'am, are you ready?
Next, Dakshish is, I think, bringing one by one.
Acha, Dakshish.
Sir, shall I
Good
take
afternoon.
up
Good afternoon, Dakshish, sir.
that's fine.
Can I do Binu sir?
Wait, Praveen sir, no, because I just joined now. Our committee will be deciding, please.
Okay.
Please.
Actually, after last presenter, next was
Yeah, all will get. Very good afternoon to one and all.
Yeah, good afternoon. Good afternoon.
Himanshu sir, good afternoon. You reach safely, Himanshu sir?
Yes, sir. Yes, sir. Okay, thank you.
If madam is not ready, then Amandeep ma'am, you are ready?
Jalpesh sir, are you there? Jalpesh sir, are you ready? Madam, hello, Abhinav sir.
हाँ sir.
The next, who is presenting of that?
Yes, please. Mr. Praveen Loni sir, available? Mr. Praveen Loni sir.
Yeah, I am available.
Sir, please
So,
share your
yeah,
PPT.
sure. Just a second.
Binu Jo sir is available, sir?
Is my screen visible?
Yes, sir, visible. Yeah, please continue.
Okay, just a second.
Praveen sir,
Yeah.
just make it full screen and you can start, Praveen. Good wishes. Good luck.
Okay, thank you. So, first of all, I take this opportunity to thank the organizers, that is the NTI and NSS and even the Noble College of Nursing for giving the opportunity for do my presentation.
Praveen sir, very sorry to disturb you. It will be good because those who presenting at that time, can you switch on the camera? So it will be good.
Yeah, just I'm checking.
Yeah, check.
Yeah, there's some issue with the internet. Actually, yeah, just a second. I'm connecting to the internet. Some issue with my other device. Actually, I have two devices I have connected.
Then okay, Praveen, continue. No problem.
Yeah, just a second. Just a second. Some issue with internet. Just,
No problem, Praveen sir. Continue. No problem then.
yeah. So is it my presentation? Is it
Yes,
visible?
Praveen sir, continue. It's visible.
Yeah.
If you make it full screen, it will be good.
Yeah, that is what I am trying. I'm
Then
trying
continue.
to put the slide. Yeah.
That side it is there. Yes, that side only. Your cursor is going in the correct direction. Yeah. Now it's
Okay.
okay.
Yeah. So coming to the statement of problem, effectiveness of self-instruction module on knowledge regarding anorexia nervosa among adolescent girls at selected few colleges Kolar. So introduction, India placed third in rate of eating disorder in the world. In India, anorexia nervosa cases have grown at an alarming rate by 5 to 10 times in the past decade, with nearly 26% of females suffer from eating disorder. Anorexia nervosa often occurs in girls, especially with 26.67% of adolescent girls, according to that is Anorexia Support Group 2022. Many girls, driven by societal pressure to lose weight, express a desire to be anorexic, often overlooking the severe suffering and health risks associated with the disorder. This underscores the importance of addressing these psychological issues called anorexia nervosa and promoting healthy attitudes towards body image during adolescence. So, objective of the study were to assess the level of pre-test knowledge regarding anorexia nervosa among the adolescent girls. Second objective to evaluate the effectiveness of SIM on knowledge regarding anorexia nervosa among the adolescent girls. Third objective to determine the association between pre-test knowledge score with the selected demographic variables. Hypothesis were H1, there will be a significant difference between the mean pre-test
Praveen sir, hypothesis
Yeah.
leave it. We have seen the objective, so no problem, no need of hypothesis. Now directly go for this methodology. Yeah.
The operational definitions were effectiveness, self-instruction module, knowledge, anorexia nervosa, adolescent girl. Assumptions were adolescent girls who are studying in few colleges having some knowledge regarding anorexia nervosa. Second assumption was SIM is an effective method to teach adolescent girl who are studying in few college. Third assumption were adolescent girls commonly have fear about becoming obese. So conceptual framework was based on general system model of von Ludwig Wittgenstein. Review of literature was organized and presented under the following four headings. First, literature related to knowledge regarding anorexia nervosa, and second heading was literature related to attitude regarding anorexia nervosa, literature related to knowledge and attitude regarding anorexia nervosa, effectiveness of SIM on knowledge regarding anorexia nervosa. Research methodology, research approach used was evaluatory approach, and the research design used was pre-experimental, one group, pre-test, post-test design. Sample size was 100 adolescent girls who were studying in few colleges of Kolar. Sampling technique, purposive sampling technique was used. Variables of the study were independent variable, that is SIM is the independent variable. Dependent variable was knowledge score. Demographic variables were age, religion, type of family, area of residence, mother's education, occupation of father, income of family, food pattern, type of food, meals per day, and sources of information. Description of the tool. The tool consists of two sections. Section 1, demographic variables, and Section 2, structure knowledge questionnaire. For each correct answer, score was given 1 and the wrong score was given 0. The maximum score was 30 and the minimum score was 0. So coming to the results, the charts demonstrate that level of knowledge of adolescent girls, which shows that in the pre-test, 80% of the adolescent girls had inadequate knowledge, whereas 20% of the adolescent girls had moderate level of knowledge. Whereas in the post-test, that is 4% had moderate level of knowledge and 96% of adolescent girls had adequate knowledge. So comparison of mean pre-test and post-test shows that in the pre-test, the mean pre-test score was 12.22, whereas in the mean post-test score was 26.03. The association of pre-test level of knowledge of adolescent girls with selected demographic variable shows that age, religion, area of residence, father's occupation, monthly family income, food pattern, type of food, and sources of previous information regarding anorexia nervosa of adolescent girl was not significant at 0.05 level. Whereas type of family, mother's education status, and number of means pattern of an adolescent girl was significant at 0.05 level. So discussion. So this was discussed under the following four sections. The section 1, that is description of demographic characteristic, was very consistent with one study. And sections 2, that is knowledge level of adolescent girls regarding anorexia nervosa in pre-test and post-test, were consistent with the 5 studies. And section 3, that is comparison of pre-test and post-test knowledge of adolescent girls regarding anorexia nervosa, were consistent with the 6 studies. Then